Okay, the recording is on. So for those who will be watching this later, hello. And probably if you ever participated in regular written webinars, you didn't see me in person. So my name is Roman. I'll be a lecturer today. We'll have, just as usual, we'll have a theoretical block with huge presentation. We have a lot of material to cover today. And later on, you'll have the opportunity to switch on your microphones, ask your questions, write them down. By the way, while we are going through this presentation, you're very and pretty much encouraged to write down your questions, put them in the chat. And later on, in the very end, after the theory, we'll address every single one of them. And one of our experts, Boris Kolersky, will join us for the question and answers session. All right. Okay, just 1 or 2 minutes, and we are ready to go. Good. So I see that. Oh, all right. Petya is still connecting, so let's wait a little bit. Guess one of our Bulgarian viewers. Okay, and Michelle is here now. Hi, Michelle. Well, seems like Petya has some problems with connection. I'll try to let her in later on. Meanwhile, let's start. Let's begin. Today we have a huge block to discuss. Today we'll cover the scanner effect, the scanner functions, and particularly we'll speak about presets that present in professional scanner devices. I know what I'm talking about because I'm also a happy possessor of one of those, which I use in my daily practice as well. So today we'll speak about each single of 32 presets that are possible to be found in Scenar Super Pro V2 or Scanner Force or Bioscanner, depending on the device that you have. And we'll discuss how you can utilize them, how you can use them in planning your therapy course, and how you integrate them into your scanner experience. So I'm super excited about it. I hope that you guys are too. Okay, Jane's saying one of my colleagues won't be able to join today. Yeah, sure. This session is recorded, so no worries. She'll have an opportunity to watch this later. Okay, let's begin. First of all, I got to remind you guys that Scenar is an awesome technology, and some of the features that you may find inside have never been realized in any other technologies before. It is smart, it is fast, it is super convenient and super compact, easy to learn, and most importantly, it is created by professionals for professionals. And because of that, it is the technology that constantly develops. It has plenty of new awesome possibilities, and the presets are one of those. So we'll cover them today and tell you a little bit more about them. So why do we call Scenar the smartest? Because it has presets. And what's so special about them? Because 24 out of 31 presets that present in professional Scenar device are presets with bio modes. And we'll talk about this a little bit later. There are multifunctional and multi-dimensional bio modes, and we'll also explain that. And that means that in certain presets, such parameters of the treatment signal as frequency, intensity, gap, and modulations are controlled automatically by the device and considering and taking into account the feedback from the patient's body, which is super awesome. Scenar is the fastest device, especially when we talk about the professional model today. The professional model is in focus of our lecture because comparing to other devices or even to home devices of the same Scenar series, when we use a professional scanner, we can achieve the same awesome positive results, the same feedback, the same positive dynamics from our patient only in 15-20 minutes compared to 20 to 30 to 40 minutes if we are speaking about the home or patient device, which is exceptional and which is vital if you are a Scenar professional who are working with patients, and if you have limited time for every session, if you have limited procedures, and if you value your time. And also, thanks to the new modern mode called D4, which we'll also cover, it is possible to spend only like less than a minute to expert the labile screen, like to expert the problematic zone and to find the most responsive spot for your further treatment, instead of inspecting the entire zone like we did in the past. Because previously we had to examine every single point, sometimes work until the dose. And if we dealt with huge, painful areas, that consumed a lot of time. So now, thanks to D4, which is integrated into some presets, by the way, we spend less than a couple of minutes to find the point we need to focus on. And this is great. Also, Scenar device is the most convenient one. First, because it's super compact, comparing to the electric therapy devices of the same kind, which are huge. Second, it has the system of presets, which makes it super easy even for those who is the beginner, even for those who just started their journey as a therapist, to have positive results. Like I mentioned before, 24 out of them have biocontrol, which are smart presets. And it is also because you can choose the desired effect or necessary treatment type depending on the problem you're dealing with. And this is it. You basically, like what you need to do is to identify the problem, identify what kind of result are you trying to achieve, and Scenar will do the rest. Scenar is easy to learn. I would like to say hard to master, but not that hard, actually. So physiotherapist with zero Scenar experience is capable of receiving positive results and is able to learn how to treat the locomotor system and get great progress in just 2 hours. It has the new treatment method, which is simple and easy to understand. There are clear protocols that have like the certain way to guide you through your Scenar experience, through your treatment process. And it has new, well-described techniques and methods that have obvious scientific background, because Scenar is something that developed over more than 40 years right now, and it is still developing. And everything that we will mention today during this presentation is not something that we came up with as Scenar creators. This is something that had been tested by hundreds of doctors we are collaborating with since the 1980s. Some doctors are with us for 10, 20 years and even more. And every single technique that we'll mention were tested on tens of thousands of patients. And this is something that makes Scenar that great. Okay, like I said previously, also new expert possibilities. First of all, once again, D4, an expert mode for searching with a moving electrode. Previously, if we had a huge area of pain, for example, if we're speaking of a radiating pain, and later on in this presentation, we'll get back to this as well, we had to find the most active zone, or otherwise we were forced to treat the entire area, for example, the entire arm or entire leg. Previously, we had to use the mode which is called D3, where we were examining each single electrode spot, and we were forced to find the initial reaction values, compare them, then find the most active one. D4 changed all that. We are now simply moving the electrode on the skin, and in seconds we are seeing which areas are active. So the time to find an optimal treatment zone is reduced, and it is super quick now. That also includes the multi-dimensional biocontrol over the treatment influence, and we'll talk about this in a couple of slides. It includes the presets with guaranteed effect, something that I mentioned before, which was tested on thousands of patients. And it also has the new feature of the most, like I believe it's the newest one, the intensity modulation, when the device changes its intensity to a certain pattern, which also increases the effectiveness of therapy. So, something to remind you of the general principles of Scenar technology. I believe if you are in this field for quite a while, you already know what it is, but just in case. Scenar is a special one device class. So it's a special class of devices, and it is the device that actually created this class, the class of biocontrolled electric stimulators. It is significantly different from other methods of electric therapy due to its technology. It uses the adaptive therapy built on the feedback data received from the patient's body. Because of that, it is a perfect multifunctional therapy, applicable in almost any situation. And it is a portable device that can replace the physiotherapy cabinet if we look at its effects combined. The correct way to read the name Scenar is self-controlled energoadaptive neuroadaptive regulation. Back in the day when the technology was created for the first time, it was 1980s. This was the original meaning of the word Scenar. Now the modern medical legislation does not allow us to name a medical device with an abbreviation, but just to know the history, this is how it used to be. And this is actually pretty self-explanatory, because it has the very principle of operation of this device encrypted in the very name. So self-controlled means that neither operator nor the factory with some pre-installed features are affecting the treatment process, but the device itself. Energoadaptive and neuroadaptive means that most important physical parameters and biological parameters that are important for treatment, such as intensity or frequency or gap, are controlled by the device. And the regulation in the end stands for the most important thing, that using Scenar, we are able not only to get positive result in some local treatment. For example, like the most simple thing, pain relief after trauma, when we treat the bruise or let's say cut or traumatized arm or something like that. We are also capable of receiving positive complex response from the patient's body, which is called sonogenesis, or the process of sonogenesis. And we are able to activate the immune response. We're able to communicate with the driver of our body, which is the autonomous nervous system. And thus, we are also capable of addressing the chronic conditions and disease, not just the acute ones. And this is what regulation stands for. Oh, perfect. So everything that I just covered is also explained in detail here. So I'm not going to stay for a long time on every of these slides, just to refresh. So self-controlled, energoadaptive, which means that the current and voltage are changed automatically in pair. And if we have high current, we will have low voltage and vice versa. So they are self-regulated by the device. Neuroadaptive means that the characteristics that are important for interaction with the nervous system are changed automatically. And regulation, yes, this is something that helps us to activate the human body's self-regulation systems in our way to put it on a rehabilitation route. So this is also an important thing, which makes it, which distinguishes Scenar from another kind of similar technology. Okay, that was a little bit of very basic theory. Now let's go to the effects. So what can we get from Scenar? Why do we need it? First of all, let's list the biophysical effects of Scenar device. What we can get from it? First, thanks to the electrostatic vibration of the tissue under the electrode, we can get the electrostatic massage. We are obtaining the effect of electroporation for certain modes. We are improving the skin permeabilization with electropermeabilization. We are directing electric potentials on the nerve fibers and the induced potentials. We're decreasing the transmembrane action potential of the nerve fibers, and we are decreasing the transmembrane action potential of mitochondria and speeding up the ATP synthesis, which is very important because this provides for faster restoration of our body cells. To make it more simple, especially for those who just started to work with the device, all Scenar effects, all clinical effects can be divided into two big groups. First, we have local effects and we have systemic effects. I already touched that a little bit just a couple of minutes ago. I said that we can first get the local effects, and it is the most simple way to use Scenar. So assume we have a domestic trauma of some certain kind. What we can get? We can absolutely sure get the anti-pain or analgesic effect, and this is one of the main purposes of Scenar. We're able to achieve amazing anti-edematic effect and the effect of lymphatic drainage. So we're removing all garbage from the lymphatic system. We get the anti-inflammatory effect, and believe me, watching the inflammation go away is something really, really cool. We have the effect of myostimulation. We can work with muscles. We improve the blood circulation. We increase the permeability of tissues, which provides for better functioning of our inner mechanisms. And we increase the trophicity of tissues, which is also great and not the least. But aside of that, this is all great, but we can also work with systemic scanner therapy. We can also work with the chronic conditions of our patients. So we are able of obtaining systemic scanner effects, which includes the effect of general regulation of the patient's body, or as we call it before, sonogenous effect or effect of sonogenesis. The effect of antioxidant system activation. This one is also truly amazing because we have objective data that shows that if we compare scanner with regular antioxidant drugs that are prescribed, Scenar is way more effective, sometimes like 2-3 times more effective than the regular antioxidant drugs, which is great. We have the effect of autonomous nervous system activation, and the autonomous nervous system is obviously the driver of our body. This is something that controls the processes that we cannot control consciously, such as digestive process, or production of certain hormones, or production of certain neuromediators that control the liver or kidney or lungs, whatever. We have the effect of stabilizing the central nervous system. I guess they have a typo here. It should be central nervous system. And we also activate the immune response of the entire body. And now let's touch ground a little bit and stay at certain effects for a little bit longer. What is included into the analgesic effect or anti-pain effect? First, treatment of pain receptors. We address them directly with scanner signal. We treat the nervous conductive paths, so we block the pain because we are overcharging the nerves with scanner pulse. We treat the gate control, which is also responsible for transmitting the pain signals. We reduce the production of histamine in the treatment zone, but we also at the same time increase the production of endorphins and enkephalins, which combined provides for that wonderful analgesic effect. And sometimes it looks really as a miracle because we are able to get it like in 1 or 2 minutes, like sometimes in 5 minutes, even if the trauma was serious. We also have the anti-edematous effect or anti-edematic effect and effect of lymphatic drainage. What's in there? How this mechanism really work? What scanner does there? It decreases the viscosity of the interstitial fluid. It increases the tissue permeabilization, so it makes it easier for fluids to move between the tissues. By its vibration message, it messages the tissue vibrates thanks to the alternating electric field of scanner device. And also it improves the drainage function of the lymphatic system. And we know that if the lymphatic system is unable to drainage, it's unable to remove some certain negative substances, it may launch a bad loop of self-developing negative condition, because this is something that we can see when we like, for example, when we look at cosmetology issues, because lymphatic system plays a huge role in how our face looks in the cosmetology and also many other fields of medicine. Also, we have the anti-inflammatory local effect. Well, this is kind of explanatory, but again, what are the steps? What are the blocks inside this huge effect? Scanner provides for improved local cell metabolism and synthesis of the ATP. It improves the phagocyte activity. Phagocyte is a blood cell that is responsible for killing our enemies or killing intruders. It accelerates the process of diapedesis. It improves the antioxidant protection, which we already mentioned. It improves the nervous regulation of the tissue, improves permeabilization, which we also already mentioned, and improves the lymphatic drainage. All combined provides for fast disappearance of inflammation. And also, we are able to provide for physiological myostimulation because we work and improve the operation of the ion channels in our body. We improve the local metabolism and also the metabolism of the muscle. We increase the ATP synthesis. We improve the nerve conductivity. We make the muscle contract when it is ready for contraction. And especially when we're using the mode of amplitude modulation, we also give it a little time to rest after contraction. And there is, like, what is most important, there is no risk of damaging the muscle. And this makes Scenar very useful tool for those who are in professional sports, for masseurs, for physiotherapists and kinesiotherapists. Excuse me. So there are also a certain list of effects of systemic Scenar therapy that is studied in numerous research materials. Unfortunately, none of them are yet translated to English language. The lion's share is still in Russian, maybe 80%, but the work on translating them is continuous, and still some of the articles are being translated and presented to the public. Plus, new articles by Western authors arise over the years, as for example in Spain or France, and we continue to develop this this field and the therapy as a whole. So the effects of systemic Scenar therapy are the anti-radical effect, the regenerative effect, the sonogenic effect, obviously, the metabolic effect, the vascular regulative effect, the surgery-related care, and this is a huge field for Scenar application. We'll talk about this a little bit later. Post-surgical rehabilitation, neuroregulatory effect, and obviously the analgesic or anti-pain effect. Let's talk about Scenar implants. So what is happening when we deliver Scenar treatment? This particular GIF or GIF, I don't know, is taken from the patent for Scenar technology, for Scenar device. And what we can see here, partially, this scheme answers the questions why Scenar is so effective and why Scenar is unable to harm our patient. Because in all other electric therapy device, unlike in all other electric therapy devices, Scenar is an integral part of this resonance circuit shown here. And we see that in the right part of the screen, this rectangle here, this dotted rectangle, is actually the human body. And Scenar sees it as a resonant capacity load. And the Scenar itself acts as an inductive storage. So this is why the human body is an integral part of this circuit, and it takes active part in controlling the treatment and the parameters of the treatment signal. This is why the body is unable to harm itself. This is why Scenar is so effective. Also, Scenar pulse is a neural-like pulse, which is pretty close by its shape by the pulse that is generated by our nervous system. It's a two-phase bipolar pulse with insignificant constant component. And at the same time, it has high amplitude, it is undamaging, and it is extremely variable, which means that scanner pulse will depend first on the place we're treating at this very moment, on particular patient, on parameters of the skin in this particular place, in this particular time. And also, since when we're standing there and doing some changes to the patient's skin, to the patient's body, the signal is able to change over time. So, for example, here we see the difference from the same position, treating the same position, and we see the difference between the first and 30 seconds of treatment. Also, for those of you who are interested, you may like to make a print screen and save it for later research. We have some scanner signal characteristics for those who are curious, who knows physics and wants to go into the depth. Here is the frequency range inside the stimulus, which is pretty high, from 500 hertz to 100 kilohertz. And the stimuli rate is 0.6 to 500 hertz. There is a certain difference because there is a frequency inside the stimulus and the stimuli rate, which you can control in the menu of your device, and which is called frequency in there. We have relatively high output voltage, relatively high output current, extreme variability, and scanner is able to work with different electrode types. First of all, of course, it is designed to work with metal electrodes, be that built-in or external electrodes, but also it is possible to use conductive gloves or socks or self-adhesive electrodes in certain way. Of course, obviously, this is limited to myostimulation or certain massage practices, but yes, it is also possible. But remember, if we're aiming for cyanogenesis, if we're aiming for a bio-controlled feedback and dealing with chronic conditions, we highly recommend the metal electrodes, and the techniques will be slightly different. Why is that? From this, we can see that scanner has pretty huge range in which its signal parameters can change. And that also partially explains why scanner is superior compared to other kind of technologies. At this diagram, we can see the comparison of scanner with different technologies such as TENS or HV or electroacupuncture and so on. Because the y-axis here shows the strength of our current in milliamperes, and the bottom axis, the x-axis, show us the duration, the average duration of the wave in microseconds. And what we can see here, we can see 4 curved lines that represent all 4 types of nervous fibers presenting in the human body. There is no more. We have only 4 types. We have A beta, we have motor, we have C, A delta. And scanner is the only device, the only electrotherapy device that is able to activate all 4 of them. This pink square represents scanner operation range if we work only with the built-in electrode, the one that is represented on your device. And this yellow square presents the scanner capabilities if we also work with external electrodes. And this is why the external electrodes are that important, because this is the only way to activate C fibers. So this is it. And this brings us directly to how you can operate your scanner. there is certain number of characteristics of parameters that you can change in your main menu, and we call them manual settings. We will have a lot of time to talk about them later in this presentation. So them are energy, frequency modulation, intensity, gap, amplitude modulation, damping modes, swing modes, dosing modes, modes of biocontrolled feedback, and the presets, which are also partially presets with biocontrolled feedback. We'll try to cover everything today. So we'll start with a little bit of theory of the standard settings, and also, don't worry, we'll cover every single one of the 32 presets. And we'll start with the very first and the most important parameter here, the treatment energy. The treatment energy is something that can be discovered even by the person who never seen Scenar before, who just took the device in their hands. They figured out how to switch it on, and apparently at some point they apply the electrode to the skin and they discover the plus and minus button, and they start to press them, and finally they say, oh, I start to feel something. This is the treatment energy, and this is one of the most important parameters in our technology, whether it is regulated by the operator or whether it is regulated by the device itself as a part of a preset. To understand how it works, we are all different human beings. Some of us have more have higher level of perception. Some of us are more sensitive. Some of us are less sensitive. So that means that we cannot set universal ranges for treatment energy that will be applicable to any type of person. But we can divide the treatment energy range of our device, which is 250 units, into 5 subjective treatment energy levels. And they are pretty easy to identify. Subthreshold level starts when you switch on your device with energy 1. You didn't do anything yet. You apply your electrode to the skin, but Scenar device is already operating. But that means that you are operating on a subthreshold level of energy because there is no sensations. You press the plus button. You can do that either by single pressings or pressing and holding it. And at some point, your patient will say, oh, now I feel something. Now I feel like some sort of vibration. This is when you reach the threshold energy level. As you gradually increase your energy, you are going to the comfortable level when the patient is constantly feeling Scenar, constantly feeling tingling or burning, slight or vibrating. And then we can continue to increase the treatment energy level. We go to the discomfort level, and then it becomes really hardly bearable for our patient, and we go to the painful level of energy. Why do we need that? And obviously, for some people, the threshold will start at energy 5. For some, it will start on energy 30. I even remember one Vietnamese guy who was doing mountain climbing, and I was treating him with Chen's, like Scenar Sport D. And he started to feel the energy of Scenar only at energy 200. Can you imagine that? So this is also possible. So you might ask, Roman, all right, I got it. Why do we need the treatment energy levels? Because this is basically how we change the scope on our rifle. This is how we choose our treatment target. Remember, the very first thing that you need to perform before doing your Scenar therapy is first, build trust with your patient, establish some rapport, and second, you need to identify the problem you're dealing with, and you need to answer the most important question to yourself. What kind of result am I trying to achieve? What kind of outcome am I willing to get from my actions? So what am I doing? If we're dealing with acute trauma, something fresh, some pain with clear borders, obviously local, then we'll be operating with high treatment energy levels. And we will look at local therapy. You see that like here, it has the word local. If we're dealing with some systemic problem, like, I don't know, bad sleep or constant headaches or some internal organ problem or, I don't know, some long-lasting disorders. This is when we address the systemic Scenar therapy, and we operate with lower treatment energy levels. And you see, it is all different. Depending on the level, we also choose which certain part of the body we are targeting with our Scenar device, whether it's nervous system or CNS receptors or CNS fiber tracts or blood vessels, or that we are hitting directly the soft tissues, the muscles, and the deep nervous tracts. Because also, the more we increase the treatment energy, the deeper it goes. And it also is different by the type of the electrode we're allowed to use. If we're talking about systemic therapy, obviously we're using just the built-in electrode. It is specifically designed for that. If we're dealing with local therapy, we start to connect the external electrodes, such as PONS, one of the most popular electrodes of our time, or conductive gloves, or facial electrodes, it doesn't matter. The only thing, like one little thing here, is to remember that when you're dealing with high treatment energy levels, because the built-in electrode is too small and the treatment energy is really high, it will be discomfortable for your patient. So we recommend, if you are dealing with pain level, use only PONS or conductive gloves, simply because you can put them far from each other, because it has, like, they are bigger than the built-in electrode, and the energy is distributed over a greater surface. And this is why it is not that discomfortable for your patient, because you need your patient to trust you and trust Scenar, because this is important. So you see that having only the treatment energy and understanding of its principle, how it works, having the good established connection with your patient, receiving feedback from them when they say, oh, this is too high, or well, I start to feel something. You can operatively use this knowledge to already adjust your therapy and get better results and get faster results. And this is what we'll be doing today. We will be revealing step by step each single of these bricks in your great building of Scenar knowledge, and we will gradually come to presets. So now we know the treatment energy, right? Let's go to frequency. Treatment energy chooses the target, chooses the type of therapy depending on the problem we're dealing with. Frequency chooses the depth of our treatment. Because if you identify the problem, if you identify the body structure you need to address, especially if you're a physiotherapist, that depends that you may want Scenar to work directly with this or that particular structure. Okay. Тамара Васильевна, можете, пожалуйста, Боре скинуть ссылочку, чтобы он присоединился? All right, sorry about that. And we see that we can regulate the depth of our treatment signal using the frequency, which is not really a frequency inside the stimulus, but instead the stimuli pace rate that we are able to regulate. Depending on the electrode you use, you see that these two graphs are different. So when we work with the built-in electrode, we are able to only work with this amount of body structures, because doesn't matter how low you put your frequency. If you're using the built-in electrode, the maximum depth that you can achieve is only about 2 centimeters, right? And it will look like a cone looking downwards to the patient's body like that, only like maximum 2 centimeters deep. If you're using the external electrodes like the PONS or double cosmetic electrode, or let's say pencils, in this case, you're able to go much deeper. You're able to work with deep muscles, with nerves. In this case, nothing is impossible. But you see that the general pattern, the general principle is the same. The lower is the frequency, the deeper is the treatment signal. And when we are working with, like if we are dealing with cosmetology issues, and we know that we only need to deal with, say, epidermis, and we don't want to penetrate the basal membrane, we'll be setting the high frequency. And if we know that we're dealing with deep muscles, with nerves, we're doing deep myostimulation after workload or training, we'll be using conductive gloves or PONS, and we'll be setting the low frequency values like 15 or 30. By the way, our wonderful professional device is different from the home versions because it is able, like the home versions only have a max of 4 available frequencies. Here you have the entire range. And remember, it is super high, from 0.6 hertz to 500 hertz, which is crazy, and which makes you available to set the desired depth of your treatment signal and achieve the desired result. The next thing here is the intensity. And I love the example. I love the hammer and the automatic hammer because it illustrates the principle of intensity. Because intensity is our cheat code. Why is that? Remember that when we go here, it is not pleasant. Discomfort level means that the signal is, well, it is still bearable, but very uncomfortable for our patient, and pain is already something that they don't want to face. There is a cheat code for Scenar when you can use intensity to double your treatment energy without changing the level of perception by our patient, which means that when you are on energy, let's say energy 50, and you put intensity 2, you're doubling that energy and you stay at the same energy level. I know, sounds crazy, but it is. What you do here is, instead of only one single pulse, which like Scenar sends every single like microsecond or something, you start sending 2 pulses at once. They are now unified and they make a so-called batch. And you can make batches of signals, like of 3 signals or 4 signals or up to 8 signals in the batch. So there will be 8 signals sent to the patient's body every single microsecond instead of only 1. And that means 2 things. First, safe way to achieve greater levels of treatment energy and achieving good results in treating deep nervous tracts or treating fresh acute trauma and getting good results, and not causing any discomfort for our patient. And second, that means that we are more likely to penetrate each single layer in patient's body. So we are able to do, we were able to increase the penetration depth even more. Also, it has the controllable feature called the gap. This is a separate manual setting, but it is closely connected with the gap, because remember that when we form a gap, we form a batch of pulses, up to 8 pulses in the batch. When we change the gap, we change the distance between the pulses inside this batch. Why do we need this? Because we can focus our energy in certain layer. We can focus it even more. This particular diagram was received using the Doppler technology. You should know what it is. When we took Scenar device, set these particular parameters, frequency of 90 Hertz and intensity 8, and we simply measured which layers of the patient's body vibrate at certain gap values. So we see that when we set the gap of 80, only the epidermis vibrated. And when we set the gap 10, we were able to record the vibration of the deep nervous tracts. So obviously, of course, if you will set different values here, you will put, say, frequency 60 and intensity 3. The diagram will look slightly different, but to help you understand the principle, I guess this is pretty much it. So we need the gap to focus our treatment signal, to focus the intensity. And what you need to remember here, that the more is the gap, the deeper is the influence. All right, let's go next. The next available parameter in our wonderful scanner, be it professional or personal device, is the frequency modulation. I call it the magic mode because it is one of the most universal things in entire scanner technology. And it is applicable to not 99, but around 85% of all situations you will face. Because this mode starts to change the frequency. Remember the one that we spoke just earlier, right here. It starts to change the frequency according to a certain pattern, going from lower values to higher values and then back. It doesn't mean that we are covering that we cover the entire range of frequency. No, we're not going from 0.6 to 500 Hertz, but we're going through the certain values, through the certain frequencies. And what we're doing here is we are trying to pick the right key to the patient's body, because most probably the patient's body will react to a certain frequency. And when the frequency is changed automatically from high to low, low to high, that usually results in positive feedback from the body. And it can be used in pain relief and anti-edematic treatment. It can be used for lymphatic drainage, for muscle training. The amazingness of this mode lies in its universal nature. Of course, you can achieve faster or more highly expressed results when you use different parameters, custom parameters. But if you are a newbie, if you're a novice, you just started to work with Scenar and you don't have an idea what to do, you're doing your first treatments, this is your magic wand. This is something that comes to rescue the day. So frequency modulation is the universal mode that you may use. And this is why we have the Swiss Army knife here. Okay. Going next, the swing modes. All right, the things are starting to get a little bit complicated here. First of all, what is this and why do we need it? A little bit of backstory. When the scanner technology was developed originally, it was developed given the certain experience of another electric therapy technologies and devices. And the biggest fear back then among the professionals in that sphere was that the patient's body will get used to the influence from certain electric therapy. For example, if we take TENS, it operates as a black box for our body. So some certain sort of black box with parameters, with some certain treatment pattern that the operator or the factory already preset in the device, and it is not changing at all, is applied to our body and start to do its thing. And yes, we receive the positive feedback, which vanishes over time. Why is that? Imagine that you have a needle and you pinch somebody. That's gonna hurt, right? But if we leave that needle in there, gradually, over time, the pain will start to disappear because our body is getting used to it. Our body is a very tricky thing. So over time, even though the needle is still there, it almost doesn't hurt. But if we start to pinch it, like to move it all the time in there, there is no way our body will get used to it. And this is why we need the swing. So the idea back then was that in order to prevent the human body getting used to electric therapy, we need to make the treatment signal the least predictable. We need to make it as variable as possible, as different as possible, which will, there shouldn't be any pattern that our body can decipher and get used to it. And this is why we have 4 different swing modes. And you see it by its name that there are different versions that are called the universal swing, the intensive swing, the careful swing, and the chaos. And going to the practical aspect of these, going to practical aspects of these modes. Imagine that we are dealing with long-existent chronic disease. It exists for more than a year in the patient's body. At some point in the past, the body was unable to use its self-rehabilitation mechanisms to cope with this with this condition. And over time, since our body are getting used to everything, it developed a new concept of normal state, right? So body considers this chronic condition as a new normal state, as a new norm. And when we will start to operate, when we start to apply Scenar, it may happen that we don't get any dynamics in our treatment. So we do something and we don't get any result from the patient's body. There is no changes. There's no change. At this point, we can end up using the swing mode because it helps the body to swing and it helps to get the body out of this position where it's stuck some time ago. This is why we have the universal swing, the intensive swing, the careful swing, depending on the severity of the problem. And we have the atomic bomb of Scenar, which is called swing 4, chaos, where such parameters as frequency, intensity, gap, treatment energy, and damping are changed absolutely randomly, in absolutely random way, chaotically. There is no way our body will not react to this. This is a very powerful tool, and there are a limited number of situations where you may use it, but to understand the principle, I guess this is enough. So these things help us get somewhere where when we start, and we don't see any dynamics or any outcome from what we're doing. So I guess this is more or less understandable, not rocket science here. And the last thing among the long list of manual parameters that you can find in your main menu of your scanner is the damping. The idea was more or less the same, but yet different. So damping was an attempt to customize the scanner signal even more. It was proposed by one of the pioneers of scanner technology, Dr. Yuri Garfinkel, who discovered that sometimes we need to make scanner more accustomed to the certain patient in order to achieve the positive outcome, in order to achieve dynamics, because this is one of the most important things in scanner therapy, to get dynamics. And he proposed that the different types of skin, depending on the texture and the color, are having different phototype. There is a phototype scale according to Fitzpatrick, and obviously they have different level. Sometimes they have different level of sensitivity, and it is possible to cut the inner shape of the signal. You see, sometimes if the inner frequency of the scanner signal is high, we can get really, really big signals here. So what he did is he flattened the half waves inside the stimulus in order to customize the signal and get it more custom depending on the skin phototype. And it worked. And this is why we have damping. It is used for personalizing the therapy and increase the resonance characteristics here. So we have 4 different damping values here, as you can see. And you can see you can use them depending. Excuse me, my laptop is getting out of charge. Right, here we go. And we can use them according to the skin phototype, or later on, 10 years later, it appeared that different level of damping also helped to customize the signal depending on the acuteness of the process we're dealing with. And it turned out that damping 1 is more effective in chronic diseases. Damping 2 is more effective in subacute diseases, and so on. Plus, they also came up with the mode which is called damping VAR, where all 4 types of damping are changing like that. Just like the frequency modulation works, just like the amplitude modulation works, the shape of the signal is constantly changing, and it is easier to find the key for a certain patient. And this is also something that automatically turns on, guess when? Right, when we switch on the swing for chaos. And what is interesting is that if you don't want damping VAR in your treatment, when you switched on the swing 4, you can go there and manually switch it off after that. Okay, let's go further. So we briefly covered all of the manual settings in our scanner, except amplitude modulation, but it is super simple. To be short, scanner operates for 3 seconds and then gives a 1 second pause, and this is great for myostimulation. If you want to learn more about amplitude modulation, you can save it for yourself and ask a question in the end. But now let's talk about something different. What are the contraindications for scanner? I need to say here that these contraindications that you can see on the screen are not something particular scanner contraindications. Most of them are actually taken from the FDA guidelines and international medical guidelines for electric therapy. And since scanner is still the electric therapeutic device, these contraindications are theoretically applicable, and we would follow them just in case. So first, we don't use scanner on the patients with cardiac pacemaker or implanted defibrillator or another implanted metal or electronic device, because this may use electric shock, burns, electric interference, or death. Well, sounds scary, but once again, this is taken from the general guidelines for electric therapy. We don't use Scenar on patients with pain syndromes that are undiagnosed. So we don't know where the pain is coming from. Why is that? Simply, like, simple example, we are dealing with the stomach pain of unknown origin. We don't know what it is. You didn't consult with your doctor yet. This may be an appendix. And yes, you may remove the pain using Scenar, and it will start to hurt less. But if there will be no surgery, we can get peritonitis, right? So we need to fully understand what is the origin of pain and what exactly we're dealing with. Also, we don't use Scenar with patients with individual intolerance of the electric current. Well, this is one of the necessary recommendations, the general recommendations, because for more than 40 years after Scenar was first created, we never ever came across such a person. So please tell us if you know somebody with individual intolerance to the electric current. All right. We don't use Scenar with patients with severe mental diseases. We don't use Scenar for self-treatment if we are under alcoholic or narcotic intoxication. We don't use it to treat the acute infectious diseases of obscure origin. Again, we need to have an idea what is the nature of the disease we are addressing. And also, we are not working on the projection of the belly on pregnant women. We don't work in the direct projection of the uterus, and never in the first trimester. This is the rule, because it theoretically, thankfully, like we never had such a case, but theoretically, just like every electric therapy, it may cause miscarriage. Other than that, you can use Scenar as much as you want, in any way you want, and in most cases you'll get fantastic results. So let's get straight into it. Finally, after the first block, we're getting right to the topic of this presentation, the presets. This is something that we rarely cover during the regular webinars. Okay, so what is the presets? The preset menu. This is a level 2 menu, which you can find in your professional Scenar device. And these are advanced tools that are aimed to make your life easier. This is something you may use even if you are not experienced therapist. Some presets have self-explanatory names, and these are the presets is a result of work of hundreds of doctors, tens of thousands of patients, and these are simply sets of parameters that are also may be dynamic according to the feedback from the patient, that are aimed at certain groups of conditions or groups of diseases. And how to work with presets, how to use them correctly, is something that we're going to discuss in the next hour. So first, how do you find the presets? That's pretty easy. You switch on your Scenar device, right? All right, it is here. And you have this arrow button. Like, first you get to the main menu. You press and hold the arrow button for 3 seconds. And voila, you are in the preset menu. And you can navigate it using the plus or minus button. So single pressings of plus or minus get you between the presets. If you want to select one, simply wait until you hear another signal. So let me demonstrate it once again for those who never dealt with the presets. Right, so we just switched on the device. We get into the preset menu. And I just selected the preset number 3. You hear that sound? That means that you just activated the preset. To get off the preset menu or deactivate the preset that you just switched on, simply press the arrow button again. Beep means that you get to the default state with no presets activated. Okay, I guess this is clear now. Yeah, everything that I just showed. So you see that when you will be pressing plus or minus button, when you will be navigating the preset menu, you will see the names of the preset in the center of your screen. And depending on the model of your professional device, there may be up to 32 factory presets. So again, what is a factory preset? It is an automated mode designed particularly to achieve a specific therapeutic effect, which is fantastic. They speed up your therapy. You don't have to navigate the main menu. You don't have to break your mind trying to identify which parameters in which combinations you need to set. Of course, if you're a genius doctor, if you are Avicenna or Einstein, you may easily identify what type of problem you're dealing with and how to combine all the previous settings that we just covered together to make Scenar the most effective in this particular situation, in this particular patient. But don't worry not. This is why we have the presets, and this is why everything has already been done for you. You only need to identify the correct preset, apply it, and start working and get results. It makes your work easier, and it makes your therapy and the positive outcomes more predictable. So what is inside the presets? Nothing fancy. We still have the combinations of parameters that we just explained. The frequency modulation, the amplitude modulation, intensity, gap, and damping with D inside of G. This is a typo. But that also means that there are certain combinations of these parameters inside the preset, and that these parameters are changed sometimes independently of each other, sometimes in complex structure, depending on the feedback from the patient's body. And this is something that we call the bio presets, and there are 24 of them, which is super cool. Right, the presets with biocontrolled feedback means that the frequency is changed automatically, the intensity is changed automatically, and the gap is also changed automatically. Remember that in the very beginning of this presentation, I mentioned that the presets form a 4-dimensional structure of therapy. And yes, there are like 4 dimensions. First dimension is the regular mode, is the most regular operation of Scenar, where we only have the automatic change of treatment signal via biocontrol. So there are like only a few presets that change only the treatment signal. Second, there are presets that change the gap, intensity, and the treatment energy at the same time in automatic mode. And this is the second dimension. Third dimension is when also we change the intensity and gap and the treatment energy. And 4 dimensions is the fully automatic mode, when all these parameters are changed automatically. You don't have to think at all. And all of that makes sense because every single preset is aimed at particular number and range of diseases or conditions. And we are going to talk about this a little bit later in a couple of slides. So what are the purposes of the presets? The purposes. First of all, of course, the emergency therapy. We are going to go a little bit first, let me give you brief information about each single preset, and then we will again repeat every single one and give you more information and talk particularly about each one of those. So what are the presets? First, first aid, emergency therapy, pretty obvious. Subacute, local inflammation in subacute phase, and anti-edemetic mode, anti-pain therapy again. Chronic pain, irradiation, point pain, local pain, symmetry, central pain. Here we are listing all of them at once. Don't worry, we will stop particularly on each one of those. Peripheral pain, joint acute, joint chronic, joint trauma. You see that some of them are self-explanatory and they are already put in some certain group. Joint capsule, trigger, preparation, myo, relax, little muscle, big muscle. Because here we use the Latin name of the muscle, musculus. So this is why it is little muscle, big muscle, myo sub, myo universal, deep myo or deep myostimulation, myostimulation relaxation, isotonic myostimulation, preparation before sports, therapy after sports, removal of lactic acid or milk acid, acute trauma, lymphatic drainage, low and high frequency modulation, and FMWAR, which is an amazing thing, an integral part of the individually dosed mode. So these are all the 32 presets on your screen, and we are going to dive deeper and talk about each one of those. All right. So before we go into the presets, this is how our structure will look like. So for each single preset on your screen, you will see this table, which has the description of the preset, the purpose of the preset, the main effects, the electrodes that needs to be used with this preset, type of the electrode, whether it's metal, conductive electrode, or rubber electrode, whatever. Energy level at which you need to operate, because remember, regardless of the preset that you chose for your therapy, you still have to communicate with your patient and set the right level of energy. Zones that are usually used with this presets, the pointing diagnostics, so places for primary treatment, type of treatment, either stabile when you stand in one place and don't move, or labile when you move the electrode over the place. Direction of treatment according to the area and anatomy, because sometimes it doesn't matter. When we're dealing with some local trauma, we can treat it like up to down, down to up, left to right, right to left. But when we're dealing with, say, thoracic spine region, we need to go up to down. We need to place the electrode vertically, and there are certain ways of treatment, and this is important. And the treatment time, proportion of treatment time and size of the treatment area. So, for example, if we are dealing with 3 electrode like area, spend 5 minutes in there. So easy to understand. And there will be a table with explanation of each single preset later on. So let's go straight into it. Also, besides talking in particular about each single preset, we will try to put these presets into several groups. We'll try to classify them depending on the types of disorders or types of diseases we're dealing with. Sometimes certain presets may fall in one or two or three or more particular groups at once. This is totally fine because sometimes the presets may work wonderful in both, let's say, biostimulation and analgesia or pain relief. So first, we'll talk about the universal presets, the presets that are okay to be used in different types of therapy and for different purposes. You see that for fast and first aid, for pain relief, we have the fast aid. For pain, for acute injuries, we have these presets that are called acute trauma, point pain, high frequency modulation, and local pain. For addressing edema or improving the lymphatic drainage in our patient's body, we have the presets called subacute, lymph, and low frequency modulation. And for massage, for myostimulation purposes, we have little muscle and big muscle. No big rocket science here. And we'll start with preset number 1. And there is a good reason why it is the first preset in the list and in your preset menu. Because this particular preset is used for fresh trauma, for trauma that just occurred, for really strong pain, for something that hurts really, really bad. Here we address the zone of the most intensive pain, the activation zones. It is used in emergency situation, and we use comfortable treatment energy. But if we're dealing with emergency situation, put it at the threshold of discomfort. This is when you will get the most out of it. It can be performed both with built-in electrodes or ponds. It is designed specifically for metal electrode. You can move it in any direction, and the treatment time is measured according to patient sensations, but no more than for 20 minutes. Because remember, this preset is something that you don't use every time or every day. This is really for emergency. When we have an unconscious patient, we can put the fast aid, put the energy at the threshold of discomfort, put the electrode right here, and this will put them back up from unconsciousness. Good example. For each single preset, I will try to give you an example when to use it. Trauma. Scenar will usually help you at any stage, but what you need to remember is the faster you start the treatment, the faster will be the recovery, the less time you will spend with your scanner. This is when the so-called scanner miracles occur. Because if you started fast enough, the recovery that would usually or normally take several months may happen in just half the time. If you are doing scanner therapy and you're addressing the recent injury, arrange your treatment as soon as possible. But of course, first you need to consult with your physician, with your doctor, that it is okay to do. And one of the scanner strengths is that we don't have to treat the affected area directly. Yes, this is great. This is absolutely fantastic, because what if we do have a recent trauma, but it is all covered by a plaster. In this case, we treat all around the plaster. And we also treat the symmetrical area, the corresponding area, but we'll use the different preset for it. So for the opposite leg, we would use the preset that is called symmetry, but we're going a little bit further. So we have our most well-known, our most interesting preset, which is used for fast aid for trauma. But this is something more dramatic. Let's go a little bit down to the ground and consider a little bit more widely seen a domestic trauma. You just bought your new shoes, right? You are really happy about them, but they're tight as hell. And especially ladies, I know you dealt with this thing a lot in your life, right? This is where Scenar can also help to recover much faster. So we don't touch the trauma directly. We are doing our therapy all around using the built-in electrode. And we are treating the blisters. We can use fast aid and it will work super effectively. It is designed for that. This is something that is directly related to recent trauma. I guess nothing to add here. Also, not to give you small small theory, I will give you some certain hard protocols. There are 3 different protocols. You can use any single one of them, or if you're dealing with some serious trauma, you can also work with all 3 of them, going one by one. So you start with the first protocol, then apply the second one, and then the third one. But they are also good separate protocols if the trauma is not that acute. So the first protocol here is when you use the fast aid, put the frequency of 360 hertz, use the built-in electrode, and treat the problematic area or the area around it, depending on the situation, for 4 to 7 minutes. Or second protocol, you use the preset high frequency modulation. This is also possible. And plus the combination of frequency 90 hertz and intensity 5. And you treat the problematic area for 5 to 10 minutes, slowly moving the electrode. And number 3, acute trauma. This is the name of the preset, and the combination of low frequency 30 hertz and intensity 6, pretty high one. Okay, so we lifted up the curtain a little bit, considering the universal presets. These are the presets with predominant analgesic or anti-inflammatory effects, starting from the most effective to the least effective one in these particular terms. So if we are talking about pain relief, we start with fast aid, but also we have different other presets: point pain, local pain, central pain, peripheral pain, joint acute, like all the joint presets actually, trigger, acute trauma, high frequency modulation. And this is where we usually use these presets. So you see that, of course, obviously trigger is used on trigger points, local pain is used on localized pain. Yes, we will talk about this later. Okay, these are the presets for acute pain: fast aid, point pain, local pain, joint trauma, trigger, acute trauma, high frequency modulation. And remember, all the presets related to pain and pain relief needs needs to be used with metal electrodes. So either the built-in or the PONs. Again, some protocol for emergency conditions here. So we also can treat the resuscitation points and zones, and we can use these settings. Also, if we try to group the presets around the chronic pain, I already saw a question about the old scars. Maybe this is related to chronic pain, but don't worry, we will address these questions in the end of this webinar. These webinars are great for chronic pain, and these are subacute, local pain, central pain, peripheral pain, chronic joint trigger, and low frequency modulation. All right, let's move to the preset number 2, subacute. This is our step 2 after the danger is over, and we now to deal with the consequences. So after trauma, we use the fast aid, we reduced the pain, we saw the doctor. Now we have to deal with the consequences of this event. And this is when we use the subacute. It is a low frequency stimulation, intensity with biocontrol. So the intensity is regulated automatically by the device. And also the gap is regulated by Scenar itself. So after the first day, after the first few hours when we used fast aid, after that we use subacute, because the body is no longer the body no longer needs the signal to be that intense, but we still have to continue what we began earlier. It is used when local inflammation is in subacute phase, and the most obvious symptoms is edema, and the pain is a result of significant local edema that compresses the nerves. So remember when we, like, for example, if you ever broke your arm or your leg, you remember that they become huge due to edema, and that compresses the nerves, and that hurts as hell. So subacute is a part of dynamic protocol of anti-pain therapy, and this is something that will get you back on track. The main effects of this preset is the decreased viscosity of the intercellular liquid and activation of lymphatic drainage to get us rid of edema. We can use the built-in electrode, the PONs, the conductive gloves, the adhesive electrodes, anything, because we're dealing with edema. We're dealing with big things. The energy level should be comfortable here, no huge energies. Any zone we're dealing with, direct zone of edema. We do the labile type of treatment. So we move the electrode over the skin or the gloves. We go in the direction of the main lymphatic pathways. So we are helping our body. We're helping the lymphatic system to drainage and to reduce the amount of liquid. And we spend 2.5 to 3 minutes for every single area of the patient's palm size, because that depends on the patients as well, because some patients have big palms or small palms. It is a convenient way to measure the size of the area, right? Right. And this is the example of the combined treatment in an acute condition. So subacute preset, the combination of low frequency and high intensity, intensity 8, the maximum one, plus the PONs. 7 to 10 minutes, comfortable energy level, and we are moving front to back if we're dealing with relatively huge area. Also, continuing our theme of, we continue putting presets into various groups by their effects they're able to provide. Presets with neurostimulation effects: chronic pain, trigger, deep myostimulation, stim relaxation, lymph, and low frequency modulation. And that brings us to preset number 3, chronic pain. When do we need it? Well, first of all, the name is pretty much self-explanatory, but we need it for treatment of chronic and long-existent pain, right? Right. Also, it can be used for treatment of fatigue syndrome and neurostimulation in case of peripheral dystrophic neuritis and rehabilitation after several kinds of cerebral stroke. It is also a part of dynamic protocol of anti-pain therapy. What do we do here? The main effects include the influence on central mechanisms of the pain and neurostimulation. Again, we can use any type of electrode. We use comfortable energy level, and we try to achieve from our patient that they report of the sense of deep vibration in their body. If we look at the zone, in case of chronic pain of central nature, and by central nature, I mean that it is located on the back between the second and the third pathway. If you remember the technique called 3 pathways, 6 points, if it is located within this area, this is the central nature. So if this kind of chronic pain is located in there, this is our client. This is where we use chronic pain. The treatment is conducted along the first paravertebral line or first pathway, the back median line, as well as along the second and third pathways, the paravertebrals, up to down, only up to down, from C1 to S4. You can open up the scheme of the spine. You can see the paravertebral names, the vertebra name, and use it as a guideline. This is where we use chronic pain. And during rehabilitation of neuritis and paretic limbs, one of the split electrodes, assume that we're using PONS or gloves, is placed centrally relatively to the limb. So shoulder girdle or sacral bone, and the second electrode is moved in labile way in projection of the nerve trunks from periphery to the center and then back. So that means that one is placed centrally on the limb and another one is moved on the limb from periphery to the center. Labile types of treatment, and the direction is used only when we're addressing the limbs directly, the paretic limbs. And the treatment time depends on the size, but again, 3-5 minutes for the patient's palm. This is how it usually looks like. So this is the central area, the projection of the thoracic spine and paravertebrals. This is where we will operate. But also, it is needed sometimes to go from periphery to the center and use the entire thoracic area if we're talking about of the limbs. Preset number 4, irradiation. One of my favorites because, well, this is a sad story with a good end. Because my mom used to have a radiating pain in her leg. And obviously the origin was not in the leg, but in the lower segment of her spine. But this preset also helped a lot when I was doing therapy, and the effects were great. It took about 1.5 treatment courses to completely eliminate the pain. So what is it used for? it is intended for treatment in the zone of pain and radiation. So the problem is actually located in our spine, but the pain is radiating to some of our limbs, to an arm or to a leg, and it may irradiate all the way to the fingers. So it is a part of dynamic protocol, and we use certain preset for the back, not this one, but we use the preset number 4 to address the irradiating area. Since the irradiating area may be really big, like the entire leg, for example, we don't want to waste our time on that. And this is why it has the built-in D4. Yes, when you switch in the radiation, there will be the D4, and all you need to do is to roll over the whole area, find the most active zone, and address the most active zone. And that saves you time a lot. Again, we use comfortable level of energy here. Any kind of metal electrode, built-in or split, any zone where we have the radiating pain. And here's what we do. The built-in electrode is placed in the most distal point of radiation. So imagine that I do have a radiation pain here, and I feel it all the way up to the palm. So this will be the most distal point of radiation. And then the electrode is slowly moved to the most proximal point of pain irradiation. So where it begins, and proximal means the closest to the spine. You should pay attention to the device's screen, locate the most active area using the D4 mode. So that means the area with the biggest number of colored bars or the biggest number of clicks that you hear. And you will be addressing these most dynamic zones. You can stay right there because this is a treatment preset, not just the D4, until the symptoms are relieved. And after you have treated the first pathway, treat the next one using the same principle, but overlapping. So if we were using this, we slightly overlap the second pathway until you cover the entire irradiation area. So this is basically it. This is the whole purpose, to treat the big irradiating areas. And here is the example, just the one that I showed you. This is what you will see on your screen. And the most active point will be right there, where you will see the biggest amount of colored bars, the red or yellow one, and where you will hear the biggest amount of clicks, just like the Heiger's counter when we count the radiation. If peripheral pain is a manifest symptom, we work with it as an acute point or localized pain, and only that we work on the original cause on the spine. So we start with the radiation area. If peripheral pain only supplements the back pain, or this is so-called echo pain, we start our work with radiation after we work on the back. So all logical. And this, we don't touch the symmetrical zone in this case, only the irradiating one, because this is irrelevant. So what are the radiation treatment parameters? Obviously, the preset irradiation, or if you don't have a preset, that might happen, we set the frequency 70 Hertz, intensity 5, D4, and use the built-in electrode. And here we can see how we can get the radiating pain. Goes all the way from the spine, and the pain is typically here or here. All right, number 5, point pain. Pretty self-explanatory here. So what is the point pain? The good answer to this question is the pain that we can show with maximum three fingers or one finger. So It is something when you ask your patient, where does it hurt? They say, here. This is the point pain. It is intended for treatment of the point pain with the built-in electrode, or it is also called the needle-like pain sometimes. Can be used for acute pain therapy with split electrodes. For example, if we are dealing with thoracic radiculitis, and this one is also a part of dynamic protocol of anti-pain therapy. Main effects include anti-pain and local anti-inflammatory effect, intended for metal electrodes, setting comfortable energy level or stronger. We need to, again, achieve the sense of deep vibration and tingling. Any localization of the zone. The way of treatment is simple, stable. Put it in there, stay in there for no more than 7 minutes, but until the change of character of pain. So if your patient says, oh, I feel that the pain is gone now, there is no need to stay there for 7 minutes. Sometimes 2 minutes is enough. Okay. Yeah. So perfect illustration. I have pain right here, area of pain, and area. If we like, the point pain is when the area can be covered with the device's built-in electrode. If this is bigger than the electrode, then it is not the point pain. So what we do now then? We have, going a little bit more, we have this. We have local pain, which is a little bit bigger than the point pain. But to give you an example, we're trying to give an example for each single case. We have the local treatment of the painful branch of the trigeminal nerve. The preset is point pain. The frequency is 120 hertz and intensity 5, built-in electrode. And this is an interesting, like I put this example here because this is unusual way to use the point pain preset. Usually we stay there and don't move, but this is one of the exceptions when we can move around the chin, around the mandibular, right to the mandibular branch, and stay there with the point pain preset. So this is one of the interesting exceptions. So sometimes you may move in point pain. Number 6, local pain. Yes, this is something that is bigger than our electrode, but yet has very clear boundaries and not that super big. So this preset is intended for treatment of pain that has clear localization and bigger size than the electrode. All the same thing here. Any pain with clear and strict boundaries, with which size is no more than the patient's palm. You should work with built-in electrode here, starting from the center of the painful zones towards its periphery in labile way with slow massaging movements. This is how it goes. Also, if it's possible, if you know the map of the lymphatic pathways, it would be great if you work in the direction of the main lymphatic pathways and the main lymphatic drainage. Again, spend no more than 7 minutes per zone. Good example. We identified the painful zone. We use the pen and we slightly overlap our painful zone by 1 electrode. You see that this is the width of 1 Scenar electrode, and we treat the entire area starting from the center, slowly massaging the skin and moving until we see the positive dynamics from our patient. Some tips on using the labile technique when you move the electrode over skin. To use the labile technique, you need to place the electrode on the skin with slight pressure. I would also recommend to do a slightly slapping your patient, not very hard. and smoothly move it within the zone with equal pressure along the recommended trajectory. Try not to press it too hard because this will create the so-called skin wave, and it will not be comfortable for your patient and for you to perform the technique. So try to hit the middle. And all right, good example here. Local pain, great way to work with it. So this is the actual area of pain with clear boundaries. You see that we are slightly overlapping. We are doing 3 passages, up to down, right to left, left to right, bottom up. So we're covering all 4 directions. This is first option with the point pain with only 1 movement. This is the second option when the area is larger than the Scenar electrode. So nothing fancy here, easy to remember. You may, well, you already have the illustrations to keep it before yourself for your future use. So I hope this will be easy to get and understand. And also, good example here is the abrasion. A Scenar treatment of the abraded surface promotes rapid healing. Before the treatment, we need to disinfect the electrode itself with some alcohol or some wipes, and the surface of the abrasion as well. The first procedure should take 7 to 10 minutes in the area equal to the palm of the patient's hand, just like we said before. Subsequent procedures are about 5 minutes for the same area. And procedures on the first day should only take up to 5 minutes. Here are the settings. Point pain, or if you don't have this preset, we can, well, this is not that effective, but yet 90 hertz plus intensity 7. And we may either move or we do single applications. For example, with the facial electrode here. Number 7, symmetry. Very useful preset. For some protocols, we need to treat the symmetrical area. You will see that a lot if you're a practicing Scenar therapist. For example, when we're dealing with joints and only one joint is affected, only one joint is problematic, still you have to treat another one. You still, like, you spend 70% of your time on the ill joint, but yet you need to spend around 20 to 30% of your time on the healthy one in order to get positive and correct feedback from the patient's body. And this is when we have symmetry. Again, it is combined with the D4 mode because we are smart and we don't want to waste our time on the big areas. And sometimes symmetrical areas can be large. We, again, use symmetry just like we use the irradiation preset. We are trying to find the most active point, the most active zone, and address it directly with this preset because it is treatment and deform and D4 in the same way, in the same one preset. The electrode is placed on the most distal part of irradiation and moved to the most proximal point. So this is taken from the irradiation description, I suppose, but yet the principle here is the same, especially when we're talking about the distal symmetrical limbs. If we're talking about the joints or symmetrical areas that are not limbs, we're just treating the symmetrical areas. For example, what is a symmetrical area? First, how do we find the symmetrical area? If our problematic zone is located within the 3 pathway zone, so it is in the center of the body, it cannot have the symmetry. This is the case when we treat with the presets that are designed especially for the 3 pathways zone. And we will talk about these presets later. If our problematic zone is located outside the 3 pathways area, just like here, it obviously has the symmetrical area. And this is the area we'll be addressing with the symmetry preset if demanded by our treatment protocol. Sometimes there may be wandering pain and we may chase it. And the same thing depends on the symmetrical area. We will need to treat the new symmetrical area as well. Here is an example of treatment. 2 symmetrical joints. One is ill, one is symmetrical. How we treat symmetrical one? We set the symmetry, frequency 60 Hertz, intensity 3. We go around with D4, find the most problematic spot, stay there with the built-in electrode for approximately 20 to 30% of the time spent on the ill joint. This is it, nothing fancy. Again, this is what you will see in D4, just to remind you. Okay, number 8, center pain. These are a small group of presets that are directly related to the disorders located within the area of 3 pathways, just like we mentioned before. So this is the treatment of the pathways that are close to the center part of the body. It is also a part of dynamic protocol of anti-pain therapy. The main effect is analgesic, the anti-pain. And now I ask you a little bit to go back and remember the preset that is called irradiation. So remember that we use it to deal with the radiating pain that which origin is located in the spine. And this are a number of presets we use to deal with the origin of that pain. Center pain is one of them, one of the possible choices. So center pain is created for the treatment of exactly the middle line, the first pathway. Only this one, not the paravertebral. So the projection of the spinous process. We go strictly up to down, labile way, and the treatment time depends on the patient's anatomy. The zone of the size equal to 2 built-in electrodes vertically should be treated for 20 to 30 seconds. So approximately 20 seconds for this particular zone. Going really, really slowly. Its brother, number 9, peripheral pain. All the same, but related to the paravertebrals, or in other words, the pathways 2 and 3. So if the previous one is related only to the central line, these 2 are related to the paravertebrals, the pathways that are close to the center. Okay. Again, the spinal column, paravertebrals, up to down, depends on the patient's anatomy, the treatment time. The zone equal to 2 built-in electrodes should be treated for 1 to 2 minutes. You see that we spend more time here, not only because we're going slower, but also because we are dealing with 2 pathways at the same time. And good way to save your time is to use the Pons electrode or conductive gloves, because you will be treating 2 paravertebrals at the same time. That will save 50% of your treatment session time. To give you an example, this is the segmental therapy of the spine. So we treat the central line, we treat the paravertebral lines with the Pons using the peripheral pain, number 9 preset. The treatment begins on one vertebra above the area of interest. And speaking of area of interest, Let me go a little bit further. Yes. What do I mean by the area of interest? This is a very useful scheme. I would like you to have it for your future purposes. When we know about our problem, where it originates, for example, we have problematic joint and problematic elbow. This will be our area of interest. This is the map of irradiation, the map of nervous innervation in our body, and it directly shows the areas in our spine, the vertebrae responsible for different zones in our body. And knowing where our problem is located, we may easily find the area of interest on the patient's spine. So we start one vertebra up the area of interest. So assume that our area of interest is C7 to C8. So we start at the upper boundary of C6 and we will finish at T1. We'll finish one vertebra below the affected area. And this is also true for the problems that are located in the center. And again, we use center pain for the central line, peripheral pain for the vertebra, for the paravertebrals, I'm sorry. And this is how it looks like, exactly. Plus, center pain can be combined with frequency 90, intensity 3, built-in electrode, and 20 to 30 seconds per one vertebra. Remember that we use the built-in electrode for the central line when we work with the center pain preset only. When we work with peripheral pain, when we work with paravertebrals, we may use either the built-in electrode, the pons, the, I don't know, the conductive gloves, whatever. We can use the split electrodes. And peripheral pain here is combined with the frequency of 60 hertz, intensity 5, and any type of electrode. Oh, pons electrodes only. This is actually a good question to ask Boris, because I always thought that we can use the built-in electrode as well. And here we can see the same procedure, but only performed on the C segment of the spine, so the upper neck. All right, let's continue our tradition to combine the different presets into certain blocks by its effects, by its theme. We have a big block of presets that is aimed at the joint treatment. This is a huge this is a huge area in Scenar therapy, the joint treatment, and many problems are related to joints. So we have a whole number of presets that can be that can come in handy here. First of all, fast aid, if we're speaking about acute traumas, symmetry. Remember that we already touched that base. Joint acute, joint chronic, joint trauma, joint capsule. Yes, we love joints, and Scenar loves joints. Trigger for trigger points, and point pain, which we already know that can be used for point pain in joints. Very useful picture. You can save it for yourself. These are the so-called magic points for treating the joints, especially if you do have the pons. The magic points were discovered again by one of the pioneers of Scenar therapy, Dr. Yuri Garfinkel, who was a former doctor who worked on an ambulance. He wasn't a paramedic, he was an ambulance doctor. And he hated things that wasted his time. Joints are rather big areas, especially when we talk about knees. And he discovered that in order to get fast and positive results, we don't have to treat the entire joint. Sometimes we only have to treat the so-called magic points, where the joint capsule is the closest to the skin surface. And this is where we get the biggest effect in terms of scanner therapy. So these are the map of the magic points. You can use it. You can save it for yourself. This is the shoulder joint. Let's stay here. And a couple of more options you can use. All that can be also addressed with the built-in electrode, but you will spend more time as you need to work with every single magic point with the built-in electrode, and spend more time if you need to treat the both of them. And now let's go through the joint family, as I call it. Joint acute, pretty self-explanatory name, aimed at the therapy of acute joint inflammation or active stage of chronic arthritis. Has wonderful anti-pain, anti-edematous, and anti-inflammatory effect, performed by the built-in electrode, by the pons, by the electroconductive gloves, and self-adhesive electrodes. So anything. Energy levels should be set to comfortable with sense of deep vibration, and zone localization is obvious. Joints, and mainly the magic points, or the so-called Garfinkel's joint points. These are all the points that you need. According to the anatomical organization of the treatment zone, counting for anatomical locations of the points of closest contact between the joint capsule and the skin, the one that we just said. Stable type of treatment, you put your pons there, you stand there on the magic points. No direction of treatment, 5 to 10 minutes per each joint, depending on the size. And again, if we're dealing with one problematic joint, what we would do with the opposite, with the symmetrical one? Correct, we use the symmetry preset. Good example here, an exclusive image, because we usually give you just, the knees and the ankles and the elbows, but one of the not that obvious joints, the mandibular joint, here is where the magic point located in this case, 10 millimeters from the edge of your ear, inner edge, and slightly like half the electrode here, and this is where the electrode should be put. Also, let us give you a protocol for treating this temporomandibular joint. You set the comfortable treatment energy, use joint acute preset, and also you may set intensity 8 and the combination of frequency modulation and damping 2. Remember the damping one, right? 5 minutes for both sides. Yeah, exactly. Here is how we treat the temporomandibular joint. Next preset, number 11, joint chronic. This is the preset for therapy of chronic arthritis and arthrosis. It is again performed by any kind of electrode. We again treat the Garfinkel's joint points or magic points, but also we can address the joint capsule. Stable, no direction of treatment, 5 to 10 minutes per joint, depending on the size. Next one, number 12, joint trauma. Again, a self-explanatory name. This was one of our goals when we created the presets, so that you will immediately have an idea which this preset is good for. This one is designed for therapy of the recent joint trauma and for therapy of joints in post-surgical period. utilizes any kind of electrodes. Again, comfortable energy level or higher. We need to feel deep vibration and tingling, or you need your patient to report whether or not they're feeling the deep vibration. Again, we are addressing the magic points, and we are presumably operating with labile / stabile electrodes. So here we can also treat the entire joint capsule. So we can go around the joint. We can even go on the backward sides of the joint in this case when we work with joint trauma. So this is okay to stand both on the magic points and treat the entire joint surface. And one of the most interesting presets, which we made separate, joint capsule. This one is a swinging frequency with wave-like modulated intensity. This one is a new feature we never ever used before. The modulated intensity is the most modern thing in the scanner technology. And it also has the floating gap, and this is amazing. And this particular preset is aimed and designed for the therapy of arthrosis. This is where we need to address and treat the joint capsule in particular. We perform the treatment before physical education, before physiotherapy, before massage, and before kinesiotherapy procedures, which provides for faster rehabilitation. Comfortable energy level. We treat the joint capsule, so we go all around the joint. We go fully labile, so we're moving, we're not standing in one place, and we spend 7 to 12 minutes per joint, depending on its size. Number 14. This one is slightly overlapping with joints, but also this is not a straight joint preset. This is the trigger point. So in trigger point, we have the swinging frequency with wave-like modulated intensity and intensity gap with biocontrol. Again, some new features. The sole purpose of this preset is to activate the so-called trigger point, and we will look at some pictures later. So it has wonderful anti-pain, anti-edematic, anti-inflammatory, and myo-relaxation effect. We set comfortable driven energy or higher. We use the standard trigger points and zones. If you're a physiotherapist, you're super familiar with that. We are pointing our electrode at the anatomical locations of the trigger points. We don't move our electrode, and we spend 3 to 5 minutes per each trigger point. And these are some illustrations that shows how the trigger point works. This is the area of pain where it is usually located, represented by the red dots here, and the black dots are the trigger points of our interest. So this is where we are applying the built-in electrode, but we can also use the pons or gloves. And these are not the only existing trigger points, but just to give you an idea of how we can address the various pain. So activation of trigger points can come about through bruxism, occlusal imbalance, or due to direct trauma. There are different possible ways. What are the treatment parameters? Trigger point preset combined with the combination of frequency modulation or FM and high intensity 8, highest possible. Built-in electrode or pons, treatment for 3-5 minutes to each point, staying stable on each one. Number 15, preparation. Now we enter the small group of presets which are intended for physiotherapy, sports, massage, and myostimulation. So this particular preset is a swinging frequency with very, very small range in high values. And it is great for massage, kinesiotherapy, or cosmetology procedures if we're working on small facial muscles using for example, the double cosmetological electrode or pencils. It activates the surface blood circulation. It provides for a great anti-inflammatory effect. We can treat any kind of soft tissues of any localization with this preset with comfortable treatment energy. And we are usually trying to follow the direction of the main lymphatic vessels, the way of lymphatic pathways and lymphatic drainage. So we move the electrode, we make it labile. Again, the treatment depends on the size of the zone. Spend 2.5 to 3 minutes for each palm-sized zone. So nothing super fancy about this description. There is a big group of presets that has the myostimulation effect. You can see them on your screen, and also you can see the main idea in terms of myostimulation, what each preset provides. For example, obviously the relax provides for relaxation. Little and big muscles are self-explanatory. Superficial myostimulation and universal myostimulation speak for themselves, just like the deep myostimulation. Steam relax is the myostimulation with the relaxation pause. There's an isotonic myostimulation, sport prep and sport after, lactic acid elimination preset, and low FM or low band sweep frequency. And these presets should be considered in the very first place if we're aiming for good and effective myostimulation. If we're looking for soft tissue massage, and also pay attention that we can use both pons as a split electrode and conductive gloves. If we're aiming for soft tissue massage, we are considering these presets in the very first place. Also, to help us navigate when we're dealing with conductive gloves, tissue massage, or myostimulation, we can always have the muscle scheme in mind. And we can, like, Scenar allows you to use pons or gloves to make any particular muscle contract in your way, how you want it. And in terms of massage, you can spend 15 minutes with Scenar, knowing the right points, and you will receive the same effect if the sumo guy, a huge 2-meter guy, was massaging you for 2 hours. Like, no kidding, I did it myself, and the results and the feedbacks from the patients were amazing. Preset number 16, Myo. This is the most universal myostimulation preset, and it is intended for myostimulation of the surface muscles, sometimes for cosmetology purposes, for small muscles in the face or other parts of the body. Here we use any kind of electrode, basically, comfortable level of energy. We need to achieve the tingling, the muscle contractions in this case. We treat the soft tissues or of any localization or any muscles. If we move the electrode, like usually we're stable, because if we want the muscle to contract, we push the certain points. But if we are moving according to the muscle fibers direction. So like this, for example. And treatment time should be no less than 3 minutes for one group of muscles, but no more than 20. We don't want to excite the muscle. Okay. The next preset is relax, number 17. The purpose is super easy, muscle relaxation. Again, any kind of electrodes. This preset is intended for myostimulation of overstrained muscles, for providing relaxation effect, for anti-inflammatory effect. The principles of operation are close to the previous presets, so we're not going to go through them again. There are two presets, number 18 and number 19, that are more specific, little muscle and big muscle. Though the names are self-explanatory, they are particularly tuned and set for treating and myostimulating the certain number of muscles. So little muscle is intended for stimulation of small and medial muscles. We are using stable electrodes, or if we're moving, we're moving according to the muscle fibers direction. And a good example here would be, for example, why not treating the chewing muscles with the pons electrode, putting two pons, putting one pon as a stable pon and one another going through the direction of the fibers of the little muscles in this case. Combine it, the preset little muscle, with frequency of 30 hertz and intensity 3, and spend 3 minutes per each side of the head, and treat the chewing muscles on the right and on the left sides, one side at a time. So this would be a good example. And obviously, the big muscles, the same thing, but for big muscles, we treat everything according to the anatomical structure that we showed in a couple of slides earlier. We treat either with stebile or labile electrodes. Usually, good results are shown with pons or conductive gloves. So same principles here. Here, like to give you some examples how we can utilize these presets. This is the way this preset is used in sports for, by coaches and and athletes that are using Scenar. Some athletes are using Scenar for a long time. We do have have positive feedback from some European and even world champions. And the building muscle mass technique includes using the big muscle presets combined with low frequency of 20 to 30 hertz and intensity 7, or using the isotonic myostimulation preset combined with frequency 45 hertz, intensity 8, gap 40, and amplitude modulation of 4:1 to 5:1. Amazing results, because this is works for the muscles as an adaptive training. It is perfectly compatible with conductive gloves or socks or sleeves, and also self-adhesive electrodes. This is probably, like, for me, is like the biggest reason to get the self-adhesive electrodes if you didn't have one. And here is the like the areas in which these techniques can be applicable. All types of muscle tensions, scars, post-operative pains. I remember that we had a question about scars, deep scars, adhesions, tissue agglutination, hardening of tissues. This is where these techniques may be useful. Number 20, Myosup. This is electromassage. This is an electromassage of the surface soft tissues. And technically, this is a swinging frequency with the high frequency range with low intensity. and intensity and gap are changed automatically. The main effects include anti-pain effect, anti-edematous, anti-inflammatory effect, and the effect of myostimulation. Any kind of electrodes, comfortable energy level, soft tissues of any localization. So this is a pretty open preset where you can be imaginative, where you can be creative in your electric massage. So go ahead, but remember that each area of the palm size should be treated for 3 to 5 minutes here. Number 21, universal myostimulation. Electric massage applicable to any kind of situation. All the same guidelines, only with but this preset is more universal than the previous ones. To give you a good example for these kind of presets, 5-6 days after the injury, as well with an old injury, the old scars, we treat the injured muscles twice. First, we treat them with the built-in electrode, then with the Pons electrode, observing the orientation of the muscle and the direction of the lymphatic flow. I already saw the question about the lymphatic pathways. Don't worry, we'll get to that. What are the device settings? First, we set the frequency of 40 Hertz, intensity 5, or we use the universal myostimulation or MyoUni, comfortable energy, and we treat for 5 to 7 minutes. If we are going through some certain area and we see that the electrode is sticking to some certain place, which is one of the signs of a small asymmetry, if the thickness is found, and this doesn't change during our treatment, we should additionally treat this zone until it is intensively red, until intense hyperemia. So and until the thickness is disappeared. So this is important. After that, we change the settings to frequency 30, intensity 8, or preset subacute, and we treat everything for 2-3 minutes. After that, we treat the symmetrical zone with frequency 60, intensity 3, and preset symmetry, obviously, for 2-3 minutes. This is a good example. Number 22, deep myostimulation. This particular type of electric massage is specifically aimed at deep soft tissues. So if you're aiming for deep stimulation, for deep edema, deep inflammation, this is your choice. We're choosing comfortable or discomfort level of energy. Again, we're using labile electrode of any kind. We are moving according with the direction of the muscle fibers, and the treatment time depends on the size, but approximately 3 to 5 minutes per one palm size area. For example, good example here, Scenar therapy after joint replacement. 3 directions: acceleration of implant engraftment, recovery of motor function, and general normalization of the motor function. So we can use the preset MyoDeep combined with the frequency of 24 Hertz and intensity 8, treatment time from 2 to 10 minutes. And this is another protocol aimed at recovery of motor function of the operated limb, according to the scheme of the arthroarthritis protocol. So we massage the muscles using these settings and using the Pons electrode. Okay. Number 23, stream relax, myostimulation for sports use, increasing of muscle strength. All like more or less the same guidelines. Speaking of the sport use, these are the most popular presets to be used in sports. Number 24, isotonic myostimulation. If the previous preset was aimed at increasing the muscle strength, this one is aimed at increasing the muscle stamina. Again, this is yet another type of myostimulation, and used for muscles of any localized according to the anatomical structure that we showed previously. And also, we have two quick, super easy to use presets that are sport prep and sports after, number 25 and 26. They have pretty obvious aim, preparation of muscles and ligaments for the physical loads, or treatment of the same muscles and ligaments after physical activity. The best way to get maximum out of your workout or out of your physical activity, running, lifting weights, this is great. But this is great to avoid any kind of damages to your muscle, the micro damages, to quickly heal the micro traumas after your workout. And also, if you're overtrained, going a little bit forward, we have the preset number 27, which is called the milk acid, and which is aimed at elimination of milk acid from your muscles after intensive workout. It is aimed at soft tissues. And again, we have the pretty more same directions of treatment, yet another wonderful effect. How do we accelerate the recovery process after the intense physical work? So this is the correct complex of procedures if you want to go fully into that. First, we do the milk acid, then the sports after, then the steam relax, which provides for adaptive training, which is great to use with conductive gloves or socks. And also you can use the self-adhesive electrodes. And this is a super addition to your workout, which helps you to stay healthier and improve your quality of well-being. Okay. Going aside from myostimulation, back to serious things. Number 28, acute trauma. This preset is designed for the treatment of soft tissues and bones right after trauma or surgery. It has the effect of trophicity, which is very important in this case. And this is the preset where we use really high levels of energy. This is something that you may want to combine with the high levels of intensity. Any zone, depending on your trauma, labile or stable electrode, any direction of treatment, but not less than 5 minutes until you see the positive dynamics. Good example here. Rehabilitation after removing the plaster. We already considered how we act when the plaster is placed. Now, what we need to do when the plaster is removed. Choose subacute, frequency 30, intensity 7. Like I said, pretty high, comfortable through treatment energy, or actually discomfortable if possible. The affected limb should be massaged with the device, moving it from the periphery to the center of the trauma. Speaking of traumas, these presets have the best decongestion, antiedematous, and lymphatic drainage effects. And these presets are aimed for the treatment of lymphatic nodes. So subacute, trigger, stream relax, and low FM. These presets are designed for built-in electrodes only. So, and also lymphatic drainage, like the lymphatic nodes are addressed only with the built-in electrode. The lymphatic drainage is addressed with the Pons electrode as well. Sorry about that. Okay, so I already saw a question in the chat regarding the lymphatic drainage pathways. Here is the scheme, just for you guys. So you may use this one to orient and see where are the lymphatic nodes located, what are the pathways, and remember that all the pathways are going from periphery to the center. And this one is also a good scheme. If we see the how it all functions, you can also save this one. And this brings us to the preset number 29, the lymph, designed solely for lymphatic drainage and anti-edematic therapy. Because it decreases the viscosity of the intertissue liquid, provides for activation of lymphatic drainage. We aim for soft tissues. We use this scheme of lymphatic system, and we follow the direction of the main lymphatic drainage. This is a great cosmetology preset, by the way. Number 30 and 31, low FM and high FM. Also a great pair of presets. Low FM is aimed at the treatment of regional lymphatic nodes and lymphatic collaterals, and also the anti-edematous therapy. But I don't use it this way. I use it for lower back pain. Because low FM, in my personal experience, provides for great anti-pain effect when you put the Pons on the lower part of the spine, on the paravertebrals. Works fantastic. I recommend. But also, yes, the lymphatic nodes is the target for this preset. So, for example, we can use it for treating the collar zone with the Pons. So we use the low FM, frequency 30, intensity 5 for 5 to 7 minutes with comfortable treatment energy. And also we have the high FM when the frequency is modulated just like in regular FM mode, but in either the higher range or the lower range. And high FM or 31 is the preset for therapy of local inflammation and radiculitis or radiculopathy or sciatica areas. Here we treat according to the anatomical structure of the treatment zone and also following the lymphatic drainage direction using the previously provided scheme. In case of radiculitis, sciatica, high pain, acute pain. So this is when we have to use the high FM mode. And finally, the preset number 32, FM war. You would see this preset even in the most complete scheme of doing 3 pathways, 6 points. If you go to our official website, remember that we put the, like when we are operating in individually dosed mode, we put the dose to the point with the biggest initial reaction. Then we compare a couple of doses or 3 doses, and we put the 0 to the biggest one. And then we compare the zeros, and we put the FMWAR as the final chord of this awesome technique, if we're doing the full version of this technique. This is an integral part of the individually dosed mode. This is an integral part of this protocol. And it is a standard combination of treatment parameters for classic scanner therapy by digital techniques. There is a huge plast of scanner theory called digital techniques, and I hope we will cover them in our next webinars. There's a lot of things, amazing things to learn. But it is aimed, this particular preset, to lift up the curtain a little bit for you. It is aimed for activation of autonomous nervous system, the one that we spoke in the very beginning of this webinar. It is performed solely with the built-in electrode. Any energy level was accordance to rules of individually dosed modes, so really low energy levels. And just like I said, it is put on the biggest value of 0 in individually dosed mode, or depending on the used protocol. So FM bar is not something that you improvise with. This is something that you will usually find a part of a certain tested protocol, tested by the doctors, by the time, by the number of patients, and by some certain clinical evaluations. So FMWAR is something that you will not spend too much time with, maximum 2 minutes. If you are curious, go to the full version of the 3 pathways, 6 points, and you will find the FMWAR. Also, to touch a base a little bit, there are certain presets for cosmetology. By the way, we have a wonderful cosmetology set of webinars. Maybe we'll rerun them too. There are preparation, myo, relax, little muscle, lymph, low FM, and myo, sup, and fast aid. So these are all intended for the cosmetology purposes, the night mask, the morning mask. I remember all these bits of theory. Here's how it looks like with pawns or pencils or double cosmetic electrode, which I find more convenient, by the way, or even with the built-in electrode here. Okay, and just a little bit, I know, guys, that's a lot of information. I'm trying to be brief here. We also have 2 presets in your sport devices. If you do have a small one, there are 2 presets, preset 1, P1, or P2, acute or system or systematic or systemic. I guess after all that theory that we covered in the previous slides, you already had an idea of what these presets are aimed at. So P1 is for acute traumas, P2 are for systemic treatment. These are complex presets with several stages. You may set them on your Sport D device in the P menu. There's also a D2 mode, which you can which operates as a D4 in big professional devices for adults. So in your small devices, if you want D4, there's D2, but it has the same principle of operation. But instead of colorful colored bars, horizontal bars, we see the vertical eye symbols or vertical or vertical symbols here. And also, we already mentioned some of those during this webinar, but external electrodes that you may find useful in all of these techniques we mentioned earlier. Pawns must have. If you're a scanner therapist, even though if you're a home scanner user, it will save you tons of time, tons of energy, tons of effort. It will open some closed possibilities. So for example, you will be able to activate the C fibers. It will make your signal deeper, so you will be able to work with the internal organs. Same for its younger brother, the double cosmetology electrode. It will give you great possibilities cosmetology possibilities for working with smaller muscles on the face, because this is not very convenient. Trust my experience. Sometimes you want to go and treat the muscles around the eye. This is why we have the double cosmetology electrode. We have the smaller version of the built-in electrode, and this electrode actually can be used anywhere you can see the words built-in electrode. It is similar by its features, but it is smaller. And sometimes, for example, it can be used with children. Because of that, we have the COM electrode for like when we need to treat the skin on the patient's head without shaving them. For example, when we're fighting alopecia. And we have the great electrode for self-treatment. If you don't have any relative who will treat you with PONS, this is a great electrode to either put on your back and fix it with elastic strap that comes with it, or wrap it around your knee or another joint and still get fantastic results. This is number one for self-treatment at home. And you can fix it on your body and do your daily chores or watch TV or work on your PC, whatever you're doing at home. And Scenar will do its job. Plus, we have the conductive gloves. I hope you already understood that in which situations they are great for myostimulation, for pain therapy, for local therapy effects, and when the treatment signal is closer to near phoretic current. So these are the conductive gloves that you can also have, and this is a great addition to your Scenar device. There's a whole block of how to use gloves correctly. Hope you will soon have the webinar about the gloves. Please let us know if you're interested about that, and we will make more detailed material about this type of therapy. And also, if you do have the gloves or any kind of split electrode, such as PONS or double cosmetic electrode or pencils, the last bit of information for today, some precautions. If you already have these, have these external electrodes, there are some certain rules for putting them correctly. If we look at the human body from above, so this is the projection. This is the front of our body. So this is the rib cage. This is the spine. This is the anterior part of the body. This is the back. This is the posterior part. What we don't do, we don't put the PONS or split electrodes opposite to each other. We don't make the current flow through the heart. Why? Because this is the part of the general contraindications that we mentioned in the very beginning of this webinar. So this is something that you need to keep in mind. So incorrect, 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 incorrect. In all these four examples, the current goes straight through the heart. Not that dangerous unless you have a cardiac pacemaker or an artificial pacemaker. Better be safe. Better safe than sorry. All right, guys? So how do we put them correctly, though? It is simple. We use the rule of the quarters. So if we take the full circle, like we imagine that we're looking at the body from the above, we see that circle. We are not putting our split electrodes too far from one another. The maximum distance between them is 1/4, 1/4 of the entire circle here. So correct, 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 also correct. And same principle here when we work with the limbs. Don't put the PONS on the opposite limbs. Don't put the PONS on the opposite limbs. Don't put the PONS on the same limbs, but they are different. What is the correct way? Remember, we already mentioned that during some slides. We have the proximal electrode right here, which is closer to the center of the body, closer to the spine, and we have the distal electrode. We have the proximal electrode and the distal electrode on the same limb. We have, again, 2 electrodes, and when we are working on the body instead of the limbs, we use the quarter technique. So this is correct. And going like giving you a little bit, like giving you a bite for the next presentation, for next materials, some positions, some techniques to work with the conductive gloves. Again, we have the stable glove and we have the active glove that goes this way. Respectable authors of these materials who contributed to all that theory in the past: Dr. Alexander Revanko, one of the founders of scanner therapy; Dr. Yuri Gorfinkel, one of the founding fathers; Dr. Alexander Viktorovich Tarakanov, MD, professor of clinical pharmacology, head of the emergency department of the Rostov State Medical University; Boris Kolersky, scanner therapist, one of our biggest contributor, physiologist, psychologist, researcher, and scientific expert. And obviously, the rhythmscannerusa.com, our biggest friends on this earth. Thank you for your attention. I guess we are ready to finally go into the questions and answer sessions. And we have Boris Kolersky, who I just mentioned, with us, who just joined. Hi, Boris.
Hi, Roman. Hello, everyone. Hello, all. I am.
And we have lots of questions today. I guess.
Yes, I am ready for your questions.
Just a second. Let me start with the first one.
Okay.
First question from Katia Alvarez. I noticed you don't have lead, Latin, or Hispanic. What scanner would that fall into? Oh, good news for you. As far as I remember, all professional scanners are translated into 5 languages, which includes Spanish, English, German, French, and something else, right?
I can try. Languages. Yes, Deutsch, Espanol, Russian, English. Sure.
All right. Question from Anna Ristova. What about joint replacements? Well, I remember that we already touched that in the presentation.
Roman said developed the short protocol, but sometime Tamara make a little publication about the joint replacement treatment protocol. Ask Tamara, please.
All right. Katya is also asking, or rods for the spine correction. Oh, all right. Rods for spine correction. Я думаю, что это версия аппарата Елизарова или металлические штыри для коррекции спины.
Это самое. Это не Елизаров, но тем не менее.
Ну, на спине бывают эти...
Понятно, это самое. Металлостеосинтез.
Да.
Yes, I don't completely understand the question. You can use the scanner, for wheat, these types of treatment. We have only one limitation. Don't touch the scanner devices and the superficial part of the metallosteosynthesis.
Don't touch the rods. That's not very pleasant.
Don't touch the rods, but you can use and in Russia is normal situation. For example, I am. One of my specialization is traumatology and orthopedic. And this is a normal situation. We have one PhD about the with the joint the fracture surgery with the metallosteosynthesis, and it's a proven situation. The scanner device can increase the соединение костей,
Bones,
process of bone
mhm.
consolidation. It's very good idea used to scanner device in this case. And else that we have few problem. One problem, we cannot touch the rods, external rods, but we can work near it, and also we can use better if we use the steel electrodes, split steel electrodes, and the skin. In this case, it's very good idea. Better if you use the split electrodes. Better if we don't use electroconductive gloves, because electroconductive gloves is more dangerous types of treatment, because it's not a complete scanner therapy, it's an override current. And better if you use the scanner everywhere. Okay. Next question, please.
All right. Next question. Natalia is asking, if there's a metal plate, not a device, is it also contraindications for scanner or not?
No, we have only one contraindication. We electric powered implant. Here it's like a cardiac pacemaker, built-in defibrillator, or the hearing, этот самый, как он называется, cochlear implant. This is very important. Or built-in implanted the electrostimulator. Only electric powered implant is contraindication for scanner therapy. The metal inside.
So metal plate is a go. So it is okay. Metal plate is okay.
Yes, sure.
I see.
Not only not only in Russia on FDA too.
All right, good. I see your hand, Katya. You have a question to ask?
Yes, thank you. What happens is that my question was directly towards when somebody has scoliosis, and it's very common that they already had a surgery for it. But when you want to treat scoliosis, there's a lot of things that protocols that you're doing on the back and on the paravertebrals. But if they had a road to fuse, let's say, two vertebrae, then you cannot use the electrode over that? Is that what you're saying?
About electrodes and heart. Okay, the biggest limitation about the split electrodes, and thinking about rules of third, and think about the electroconductive gloves. It's very important thinking about electroconductive gloves. I want to make you a little demonstration. Okay, I have a scanner device. I increase energy of the scanner device to here. Okay, I have it. Scanner device. I have a split electrode. Okay, and I have pulse oximeter. On the pulse oximeter, I switch on, and I want to show you where my.
Борис Павлович, я думаю, что вопрос был немножко не в эту степь, тем более, что мы сейчас только что про ограничения, про электроды рассказали, что так нельзя делать. Вопрос был про то, что если используется аппарат для коррекции спины, и там вот конкретно два штыря в позвонки, я так понимаю, втыкаются, и сделаны для того, чтобы спину держать ровно. Есть ли какая-то лимитация или нет? То есть можно вокруг них работать?
I'm sorry, I won't understand it, your question. Yes, you can walk here. Yes.
Yeah, you can work around the rods. So nothing. No contraindication here, but just don't touch them with the metal parts of the electrodes.
So that would mean that, say, for example, if we're working on the central line, we interrupt the central line and then place it again?
Exactly.
Maybe.
Смотрите, то есть смотрите, если
Я
там
understand.
прямо вот по центру,
Understand.
да-да-да, то есть мы прерываем центральную линию или
I
нет?
understand. You're thinking only in the typical standard the scanner paradigm, but it's not only one paradigm. It's not only one paradigm. Soon we make a good translation and we make one more webinar for the local therapy and therapy for this type treatments with the presets. Why I make these presets? I make these presets with Germany doctors in physiotherapy and in the manual medicine and from neurology, orthopedy, traumatology, etc., etc. For rehabilitation in surgery, traumatology, orthopedy, etc., in normal medicine concept. For using with the German physiotherapists. With the German physiotherapists, it's in medical practitioners. It's a medium medical practitioners, then less than doctor, more than nurse. And with the good knowledge about the anatomy, physiology, and rehabilitation. And this is very important. In few days, we can study to treat any types of the locomotor system disease and neurology using the presets. The presets, it's a first step, it's introduction in these types of scanner therapy. It's a different type of scanner therapy without asymmetry, without center and periphery, with only with anatomical and physiological principles based only in the typical physiotherapeutic mind, because we take a typical physiotherapeutic mind and put scanner therapy without disaster, like a butter on the bread. Very easy, without any problem. We can save time. We can make easy treatment. And what is important in this case, the scanner treatment procedure, the treatment procedure with scanner, you can get good results in 50 minutes, anytime. And sometimes you don't need more than 20 minutes if you treat treatment propose
Goal or aim.
Yes, it is a treatment goal. It's the treatment of locomotor system, the locomotor system rehabilitations, the sport medicine, etc. If you don't think about the treatment healing of the healing body. Why? Because it's one more way in the Western medicine. The typical scanner therapy, it's not a treatment, it's a healing. It's a healing. It's not treatment of their problem. It's a healing of human body. Anytime if you work with the scanner device, you don't think about the disease. You think about the healing of human body. You healing human body. You don't know the what's problem. You heal your patients. It's a very difficult way sometimes, because you need make a big reformation of your brain. You need more knowledge, but this is more easy way. You don't need to change your mind. You put skill to your exactly work it mind, and your mind work it more faster, more easy. We put to use solution like oil in the gear. That's it. In this case, don't think about the for working with the scoliosis. If you're working, if in your patients with the scoliosis, put it the destruction system, implantation destruction system. That's and you don't need to think like a scanner therapist. You need to think like an orthopedic. You need to think about the powers, and you think about the kilograms, the loads, and the mechanical works. Because if you're working with the scoliosis, you're working with the mechanical system. If you try to treat in normal case, sometime maybe you have some problem because, for example, инородное тело.
Oh my gosh. Just a sec.
Okay,
Just a sec.
Some metal in the human body, it's not normal, normal situation. And if we try to heal human body, the first reaction of human body, I need to extract this
Foreign body.
какой?
Foreign body.
Yes, foreign body from self. And you don't treat the scoliosis. You stimulate the scanner human body and the implant, because it's not easy work. And what is very important, need to think before treatments, and need to understand what is your goal of your treatments. If you don't completely understand what do you want to do, if you only perform the treatment, one technique, next technique, what is your results? What is result of your technique? What's exactly in the patient body? You need to understand what's happening in human body. Okay, and thank you for your question. And maybe next time with Roman, we may perform a webinar about the local therapy, and it's easy way, and it's one more way for scanner therapy. Maybe it's one more step to make scanner therapy more popular and more easiest. You need to only knowledge about the anatomy, like a muscle or physiotherapist, and that's it. Absolutely typical. Okay, next question, please.
Next question is also from Katya. Let's go one by one. She writes, my husband is really intolerant to scanner. He's too sensitive except when using adhesive electrodes and very low energy.
Self-adhesive electrode is not scanner. Self-adhesive electrode is not scanner.
Борис Павлович, тут вопрос такой, что мы тут обсуждали индивидуальную непереносимость электротерапии. Вот, и она сказала, что да, сканер, он нетолерантен, кроме как...
If you too much feel the scanner therapy, in this case, I try make one more recommendation. How to make the scanner more tolerance. Try to use the electrodes with the electroconductive rubber or electroconductive silicone. In normal situation, it's make scanner signal not good, not so good, but maybe in your or only in your. situation, it may be not so bad.
Um, okay, next question from Nancy. Checking the presets on my device, Rhythm Scanner Super Pro V2. Does it have the presets? It's not loading. I don't quite get this question. So you can enter the preset menu by switching on the device and pressing and holding the square the arrow button. So yeah, the arrow button over there. They should be there. Okay. Regarding the traumas, ice skaters can really use this when we're in new skates. Oh yes, yes, and not only that, like we men, the nation of men, we suffer from new shoes as well. Those that you need to wear with the costume. Siva is saying, can you also talk about how quick we need to move the device on the skin? Does it change with preset, or it's the same with all the setting? As when you say slow is 1 centimeters per 2 seconds, or
okay, the fastest speed with any types of presets is 1 centimeter per second. It's the fastest.
This is the fastest. This is the fastest.
It's the fastest.
Okay.
And need to move scanner less faster. Why? A lot of presets. It's exactly. It's a presets with changing frequency. Maybe it's a swinging frequency in the very short range, or the bi-mode changing frequency in the short range, not so fast. The scanner device in preset, it's absolutely important, impossible to brushing. Brushing absolutely impossible to any types of scanner devices, because it's not a scanner, it's a dark sunval devices. You kill the scanner influence if you move.
Let me translate what Boris is saying. If you move fast, really fast, faster than 1 centimeter per second, you make scanner into Darsenval by its features. So yeah, well, you will still get the effect, but maybe not the one you're aiming at. Katya is saying, when working around blisters and using fast aid, do you place electrode on each point during 4-7 minutes, or you divide the time between all the places when you're going to place the electrode? Obviously, you spend 4 to 7 minutes for everything, so for all areas around the blister. So
you can work in the typical situation, in the emergency situation. We don't use dose mode. We working in the only subjective dose mode. Because we haven't time. Exactly, I am from emergency medicine, and emergency medicine, we haven't time, and we don't use too much dose mode because we haven't time. We have few minutes for treatment, and we working with the move electrode. And what's is very interesting, then the Dr. Garfinkel was alive. We have 2 scanner therapy. The scanner therapy with dose, it's a Rivenka scanner therapy, and scanner therapy without dose, it's a Garfinkel therapy. I am I study from Yuri Garfinkel, and I replace Yuri Garfinkel in KB.
So yeah, Boris is a disciple of an old school.
Yes, I'm old school, and I'm from emergency medicine, like Yuri Garfinkel. Yuri Garfinkel, emergency doctor. I am emergency doctor, and Dr. Rivenka is not emergency doctor. He is neurologist.
So yeah, basically there are two approaches. Both of them
He have
work.
a time. He have a time. He is an academical doctor. But we working without time, without hospital.
In a fast-paced environment.
Yes, it's different type of thinking.
Also, like that follows another question. Also, you can use metal electrodes, rotating them on opposite points around the blister. Well, some sort of. So you can go like that. Yeah, put it vertically. Why not?
In this case, it doesn't matter. You can, for example, if you have split electrode, you put one electrode, for example, sometime in laterally and one electrode to work. You can working with the two electrodes. Doesn't matter because exactly clinically you get the similar results. What is very important? I am, for this time, I'm the deputy director of biomedical issues, and I am a chief about the certification. And I have all the academic information about the scanner therapy and all scientific information for scanner therapy. And in this case, exactly a lot of different techniques. If we make clinical trials, we get the similar results, or results have a difference near the 10%. It's nothing in the clinical example. For in the normal situation, what is very interesting in the science, in the scientific trials, one doctor making their scientific plans. One doctor or intern may perform a procedure. Second doctor collect the data, and next doctor make an estimation the data and to look what's exactly here. And all doctors working separately and independently. And we prove it from mistakes. And in this case, plus minus 10%, it's nothing. A lot of techniques have a similar results. If we have a few or similar techniques with the similar results, if one user prefer these techniques, okay. If one more user want make him perform one more techniques, it's okay. Because scanner therapy, it's integrative medicine, it's very big. We have a lot of techniques and unopened techniques, more than we can imagine. Maybe you found the most effective technique in the future. Working, make trials. You're welcome. It's open. Scanner, it's open source system.
Okay, moving next.
Mm-hmm.
Boris, probably we need to like cut down the time for answering the questions to cover them all right? Okay, so how about old injuries and old scars? We also covered that during the presentation. So yeah, I remembered about that, and yeah, we showed the protocol for old scars as well. So this is for Nancy.
Okay, about old scars. It's very that is the scars. Scars is plus tissue. Scar is plus tissue. It's a tissue with the not so good amount of blood vessels. And because in the first step of treatment of a scar, it's a revascularization. And in this case, we need to look to our patients. If our patients have a lot of scars, and each problem maybe it's a problem of it's a systemic problem, and in this case, I can give absolutely good prognosis. But if we talk about maybe a young person or a person less than 40 years, maybe we can get good results. But if the scar is it's a hyperplastic scar with the plastic tissue, we need the surgery. And after surgery, immediately we can use scanner device. In this case, we can get absolutely excellent results, in my opinion.
Okay, next question. So, when working with a preset with built-in D4 and finding the most active point, we just stay there without changing parameters because D4 does that automatically and gives the biocontrolled signal. Борис Павлович, вопрос такой. В тех пресетах, в которых встроено D4, вот мы нашли место, мы просто там стоим, потому что мы и
Мы
так
ждем,
лечим.
пока перестанут меняться циферки. Sure.
That's correct. That's correct. You simply look at the screen and wait until the digits stop changing, because this is the preset with the D4, not the pure D4. Next question. So if you have a particular point and you want to use pawns, you put them around the particular point, right? Not quite understood this particular question. Could you please clarify for me?
What is the particular point? Maybe you can switch on your mics.
When you were talking about local pain or trigger pain, you also said that we could use pawns, but then do you leave one of the pawns on the pain and then the other one moves?
Point pain. The first electrode for point
No,
pain.
not point pain. Local pain. Local pain. Борис Павлович, да, local pain, да, то есть мы одну пешку держим, а другой ходим или двумя ходим?
Point pain, the both variants available.
So both. You can either have one stable pawn and operate with another one, or move them both.
You can get the similar results because between the pawns or electrodes, the distance between the pawns electrodes is 10 centimeters, 20 centimeters, or 2 centimeters. Exactly for superficial influence, it's not in these presets doesn't matter, because point pain or local pain presets, the first purpose it's working with the nerve stimulation and working with the beta alpha nerve receptors in nerves. In this case, you working with the nerves, and it's a superficial treatment or medium, superficial medium deepness, maybe maximum deepness 2 centimeters effects, and in this case doesn't matter the distance between points. If you want to working with 2 pounds, okay. If you're working with 1 pound,
depending I would say depending on the side of the local zone, because sometimes it would make more sense to use the built-in electrode, if you ask me.
Yeah.
Okay, next question. Can you also use D4 on the central line?
I think yes, why not? But for correctly working in D5, you need to correctly you need to sitting and bend to front, because you need to one line, and better if you use the facial electrodes in this case. Why not use?
Next question.
For
Yeah.
for symmetry and for irradiation presets with D4 you anytime using only combined electrode, like a built-in electrode and the facial
Electrode. Ну, это мы прошли, Борис Павлович.
only.
Это и так уже
Don't
упоминалось.
use this split electrodes. Okay.
Okay, can you please share magic points of the hips for
One moment.
quadriceps
One moment.
insertion points?
Roman, Tamara sent
Yeah.
them by email already.
Oh, all right, you got it. Super. Okay. Going to another question from Gayla.
And hold on, Roman. And if anybody else are interested in magic points, just contact Tamara and she will forward you the email. Thank
Yes,
you.
I'm sorry. Okay, we with Tamara.
Boris, we're yeah, answered that question already. Okay, the next question is from Gila. What is the best method to use the hair electrode for cognition, for anxiety, for depression, for Alzheimer's, for clarity of thought, autism, ADD, ADHD?
Only for using in the higher parts of human body or animals. We don't think about the diagnosis. If we're thinking about the systemic disease, we anytime working in the systemic treatments with the numbers, and we think about the healing of human body.
Not the type of the electrode.
It's
Right.
not the type of diagnosis. We can exactly 3 types of arthrosis, but we can completely thinking about the Alzheimer.
I would say that the best, like the best way to use the COM electrode is alopecia, for example, or
for alopecia. In the beginning, for alopecia, we have some 1 hour doctors make a PhD for alopecia treatments. And for alopecia treatments in the beginning, he start working built-in electrodes because the first phase is they completely be shaving the hair. Shaving with hair and working in their skin will be built in electrodes. After maybe 1 week, we can available working with the built-in electrode and use their combo electrodes. And also he performed 3 pathway 6-point on each procedure with the high treatments. And high treatments perform on high frequency, 360.
Okay, next question from Natalia Folger. What are the ways to combine presets for a cosmetology treatment? For example, can I perform lymph, preparation, and myostimulation in 1 session?
Why not? Why not? Why not? Anytime the presets mean only effects. If you choose presets, you choose 1 purpose. Maybe your procedure include few steps. On each steps, you need to use 1 of type of presets. Why not? Exactly.
Oh yeah, you're free to combine them.
Because open system. This system make it for we make this system to make your treatment more easy for not need to keep in mind a lot of parameters, working in the manual modes, and sometimes more comfortable because the biomodes, 2D biomodes make a treatment more comfortable for your patients. That's it.
I will translate the next question directly to Boris first.
Мгм.
Борис Павлович, вот тут вопрос. Мы, когда даем техники вот в той презентации, там говорится пресет такой-то, и потом FM, допустим, плюс intensity, ну, интенсивность такая-то. Мы подразумеваем, что надо включить и пресет, и потом вручную включить
Да.
FM и интенсивность,
Это
или
заменяет.
подразумеваем, что это внутри пресета?
Это замена, если у вас аппарат без пресета.
Okay. So, yeah, answering question from Gayla now. I will first say it out loud. When you list frequency, intensity, etc., after a preset, are you saying this is what the preset is using, or are you saying that we need to add those modes to the preset? No, we're not adding that. This is only the way to slightly substitute this preset using the manual modes if you don't have this preset in your device. So if you are having the preset, you don't need to set anything.
Роман, надо сказать, что в пресетах обязательно есть дополнительные какие-то биорежимы. Это не просто замена 1.1. Зачем мы тогда делали пресет?
Да.
Я так и сказал.
Он
And
так и сказал.
so this is only just a way to partially substitute a preset if you don't have it,
Okay.
because you will not have the bio mode, the biofeedback if you don't have the preset. But this is like the possible alternative if you don't have it. Okay, the next question. In the MyoUni preset, universal myostimulation, you wrote that the time of treatment for the injured muscle is the same as the symmetry muscle.
If you're working,
На слайде было, наверное, так написано.
maybe if you're working with the muscles, you anytime thinking the time of working in the muscles, it's not a time, it's a feeling of the muscles. If you're working with the massage presets, if you're working with the myostimulation presets, the first then you're thinking it's not a time, you're thinking about the contraction. If your muscle contraction is better than before, it's okay. Because it's more important the objective situation of muscles. For example, in the beginning, you feel a little contraction is weak at muscle, or in the second step, it's good, better. Oh, okay, that's it. For this time, few weeks ago, Professor Fadiev in St. Petersburg published a new article about the muscle stimulation and muscle relaxation with the scanner devices. What's very important. In typical situation for total muscle relaxation with the objective control with myography, need more than 40 minutes with the regular electrotherapy unit. But the scanner device need from 12 to 50 minutes for similar results. For scanner device, we not need a lot of time to spend the procedure. We reach results. Oh, better stimulation. Okay, next muscles. Don't think about the time. Think about your patients. Next question, please.
Okay. Yeah, the next question. For the sport recovery protocol, the damp electroconductive garments are recommended. How do we use them exactly? Damp sleeves on arms?
If you use the sleeves here, and for example, the gloves here or socks, yeah. Exactly. One of the last pictures about the electrical safety we can show. Разрешите мне, пожалуйста, показать экран?
Да, конечно. Пожалуйста.
Ты уже разрешил?
Угу.
Хорошо. Okay. Please look here. You put two garment here and put garment here. You put garment here and here. That's it. If you're working, or maybe if you're working to the leg, maybe you dress garment here and working with only one glove in the leg, or you can connect through a splitter, few wires, one wires you connect to the как он называется, рукав, sleeve, and to next wire you can connect two gloves with one poly gloves and working with two hands in this case. Why not?
Okay.
Everything is possible.
Next question. How do we change the language setting?
To change the language setting, you need to switch on your device. Switch together the arrow and plus button and push arrow button 4 times to language bar and switch language with the plus.
Okay, so the combination of arrow and plus leads you to the service menu, and then using the plus button you're navigating and yes, and selecting the language. Okay, so pressing the arrow and plus. Okay, the service menu. Yeah, the service menu.
Некоторые приборы, которые куплены на российском рынке, не имеют возможности изменить это язык.
Да, нелегальные приборы, они не имеют возможности.
Да.
Но вот вы думаете, у кого-то тут такой есть?
Надо сказать. Если
Okay, but yeah, but this is true only for the devices produced for the foreign market. So not for the Russian market or the market of the former CIS. So yeah, only for European or American or Australian devices. Okay, could we possibly have a lesson on scanner paradigm, philosophy, and holistic learning approach? Можем мы устроить как-нибудь отдельный вебинар по сканер-парадигме, по сканер-философии, по холистическому подходу?
I'm not holistical doctor, and I'm not in holistical medicine. I'm working in the normal university medicine. I'm working in the Rostov State Medical University. I'm working in the Federal University and in biology department. And in this case, it's not talking for me. Philosophy, it's not for me. For me, it's biology, physiology, anatomy, etc. Electrophysiology. I know how working scanner pulse working exactly. I know the names of ion, proteins, etc., etc., etc. I haven't thinking about the philosophy. All my books about the medicine, physics, not philosophy. It's not from it. I'm sorry. Maybe Iosif Sinikatov can help you.
Okay, we have a big question from Alexander. So, in the context of anti-pain effect of Scenar, you have mentioned increasing the production of endorphins and enkephalins. How do we gauge this process and actually detect the release of endorphins? Since enkephalins serve as neurotransmitters in the brain, the same question, how to detect and confirm the increase, is in place. Enkephalins all are super important. Some studies showed that enkephalins are even preventing cancer cell growth. Thank you for great presentation.
Okay. Yes, this is question for me. Okay, thank you. It's only one. It's only one of 12 mechanisms of anti-pain effects of sclerotherapy. It's only one. About the encephalin and enkephalins and endorphin testing. In the first medical university, medical academy in Russian academy in by Scenar in the Moscow, in the Cathedra of the Physiology and the Non-Drug Therapy, by some professor, and we in some Russian scientists research the method of the detecting of enkephalins and all the peptide continuum microdermals and the regulatory peptides, and it's a very, very interesting topic. And we perform a few a little pilot experiments with the Scenar device, and we exactly found the Scenar device increase really levels of enkephalins in the liquor and the blood, etc. And on animals and in human too. But it's not only one anti-pain effects. We have a lot of types of anti-pain effects, one of 12 anti-pain effects. We have a few big effects like the gate control too, for example, and more and more. Maybe it's very interesting if you come to our webinar about the effects of Scenar therapy, and look here, because few effects of Scenar therapy effects we showed in this webinar. It's a short webinar, maybe in next month. We'll repeat it. It's not. Так, дальше.
Okay. Please outline briefly presets with guaranteed effect. Yeah, sure, we will. Michelle is asking, Boris, how can I get trained and certified from you?
About the training and certifying, we for this time now we can teach our teacher in the some. Сейчас Рома еще скажу. То есть есть понятие конфиденциальной зоны. То есть если этот товарищ находится в зоне какого-нибудь представителя регионального, то он должен спросить у него разрешение, например, Тамара. И для того, чтобы научиться, нужно, как говорится, пройти вебинар, который занимает несколько дней, а потом сдать успешно экзамен.
Спросить разрешение на прохождение?
Ну да, соответственно, работать.
Okay, Michelle, so depends on your location. So first you need to identify official scanner representative in your area. For example, if you are located in the United States, Tamara Goncharov is the official representative as the head of Rhythm Scanner USA.
Tamara Goncharov is director Rhythm America. Is director.
Я так и сказал. So she's the director of Rhythm Scanner USA. And you need to contact her first and ask for permission to be certified. After that, you undergo the series of online training with Boris, for example. And after that, there will be a test. If you get certified, we send the official certificates issued by the manufacturer of scanner device that you have taken the course and know this or that aspect of scanner therapy. Okay, how many presets are there with D4 integrated? Сколько пресетов с D4? 2. All right, great. And another question from Katya. With D5, we do work with meridians. So that could also fit into holistic approach, isn't it?
No, it's not only what is the problem? The problem about the approach. In Russia, the reflexotherapy is a part of the normal medicine. And we don't think about the D5 and the reflexotherapy only about the Chinese paradigm. In the Soviet Union, we have a few biggest scientific research institutes with 100 doctors with very, very big backgrounds, and we make a reflexotherapy like a part of normal medicine. And we change name. It's not Chinese medicine. It's not holistic medicine. It's a reflexotherapy because reflexotherapy operated the normal no system reflex. And it's one more possibility we dialogue with no system. That's it.
Okay. Alexander is saying, Boris, thank you very much for this elaborate answer on enkephalins. Please let me know how can I learn more about this study, research, and your experiences in this respect. For Boris and Tatiana, you can reply by email to be efficient with time here.
Yes, Alexander, you can write to me to my email. You can contact me, and if you have something interesting, maybe we can talk about the enkephalins, etc.
Роман, заканчивайте, спасибо.
Okay, I guess this will be the final question for today. We already did a pretty great job, I guess. There were tons of questions. There were tons of materials. So we are all awesome. Me, Boris, all of our viewers, thank you for participating and for listening and for being proactive today. I hope to see you more than once in the future, that we will continue to discover scanner therapy together. I hope that you will enjoy your journey helping people with scanner and discovering its possibilities. Thank you from my side, from side of Rhythm Scanner USA, and from us, scanner experts.
Thank you. Thank you, my friends. I hope this information helpful for you and your scanner therapy skills improved, and you can use it and I hope we make for you more interesting webinars. And thank you, Tamara. Thank you, Roman. Great job. Thank you. Thank you.